Welcome and Assalamualaikum kepada yang baru masuk webinar. Welcome and morning kepada yang baru masuk webinar. Peringatan semula, email telah diberikan berkaitan dengan material-material. Ada 3 dokumen iaitu test plate, record form dengan manual. So harap partisipan dah print untuk rujukan semasa webinar, dan kita akan ada sesi praktikal ataupun hands-on jugalah menggunakan material yang telah diberikan. Welcome and morning kepada yang baru masuk webinar. Ada lagi yang sedang tengah cuba masuk, kita tunggu sekejap lagi ya. Okey, rasanya dah 60 lebih partisipan. So kita start kita punya webinar lah. Okey. Alright. Okay, Assalamualaikum and good morning to all participants. Morning. Assalamualaikum.
Morning.
Morning.
Waalaikumsalam.
Okay. Alright. First, I would like to thank to every participants yang attended this webinar. Okay, alright. Our webinar today is about motor-free visual perception test version 4. So, alright. Banyak thanks to participants sebab sudi untuk join webinar ini. Okay, and then first and foremost, I would like to convey special greetings to our webinar advisor, Associate Prof. Dr. Akeshan Dahlan, and our senior lecturer UiTM, Mr. Chandra Kanan. Okay, good morning, Prof. and Mr. Kanan.
Good morning, Mr. Anam and all the presenters. I hope you all in good conditions, and to participant, thank you very much for participate in this excellent webinar. I think you all very lucky because you have the opportunity to participate. This is very important assessment, and I'm sure and I hope that you take the most opportunity to learn and this new assessment. Thank you, presenter, and well done.
Okay.
Morning. Thank you, Anam, and all the team. My name is Chandra Kanan. So thank you for giving us this webinar and early morning like this. And I'm very sure the participants will not go empty-handed because this is a new assessment which will be introduced by this group. And also we have a very prominent speaker as an introductory, which I'm not going to mention now. So it will be very good insight for all of us. Thank you very much. Bye, and all the best for you.
Okay, thank you, Mr. Kanan. Okay, alright. So kita akan tengok dulu tentatif webinar pada hari ini. Semua nampak juga kan kita punya tentatif pada hari ini? Okey.
Nampak.
So kita akan mula. Okey, so kita akan mulakan dalam jam 9.15 lah. Kita punya start webinar dengan special invited speaker daripada Hospital Permai, Mr. Hazlan. Okay, and then kita ada topik berkaitan dengan overview berkaitan dengan assessment MVPT ini, and then kita ada juga berkaitan dengan psychometric properties untuk assessment ini. Kemudian kita ada sesi administration and scoring untuk MVPT, and then last kita ada sesi how to interpret this assessment. And then last kali kita ada practical session. So lepas presenter ataupun speaker ajar macam mana conduct and then interpret score tu, nanti kita akan minta peserta untuk practical session. Okay, so pastikan semua peserta telah print ataupun ada material yang telah di-email lah. Okay. Alright. Okay. So without further ado, I would like to introduce our panel speaker. Okay, I introduce myself lah. Okay, I'm Khairul Anam. Currently working occupational therapist dekat klinik kesihatan Tandik dekat Sabah. Okay. Kemudian kita ada Cik Norzi Azlaili, occupational therapist daripada Hospital Putrajaya. Okay, you want to say something, Nozi?
Assalamualaikum and morning to everyone. So I would like to thank you and welcome everyone. So I hope that we can share this knowledge today. Okay, thank you.
Okay, alright. So Nozi akan bagi tahu pasal topik administration and scoring of MVPT. Kemudian kita ada next speaker, Miss Liliana Davina, OT from Hospital Selayang. Miss Liliana, you want to say something?
Hi, I'm Liliana. So thank you for participating in our webinar today. Hope you guys can get some more knowledge in performing MVPT on your patients, especially children lah. Okay.
Okay, alright. So Miss Liliana will talk about the overview and clinical utility of MVPT. And then we have next speaker, Miss Hanis Hidayu, OT from Hospital Kuala Lumpur. Anis, you want to say something?
Okay, Assalamualaikum and good morning to all. My name is Anis. So I'm the last speaker today. Hopefully we are going to enjoy ourselves with this webinar. All right, thank you.
Okay, alright. So Miss Anis will talk about interpretation of the result MBPT. So harap semua peserta ambil perhatian juga topik Anis ni sebab nanti susah kita nak interpret data ataupun skor dalam MVPT tersebut. Okay. So next, today we are very honored to have a special invited speaker, a well-known pediatrics occupational therapist. I think semua orang, kebanyakan OT akan kenal dengan kita punya special invited speaker today lah. Okay, Mr. Muhammad Hazlan. Mr. Muhammad Hazlan akan bagi tahu topik berkaitan dengan evaluation of visual perception skill in children. Okay, I will brief some background of our special invited speaker. Okay, alright. He have a bachelor degree in OT, UITM, and then working experience sebelum ini beliau pernah bekerja dekat Hospital Pakar Sultanah Fatimah, Muar Johor. Kemudian beliau bekerja dekat Hospital Encik Besar Haja Kalsum, Keluang Johor. Dan sekarang yang terkini baru berpindah dekat Hospital Permai lah. Okay, so additional working experience untuk Mr. Hazlan, selain daripada tu beliau juga adalah professional speaker ataupun trainer. Beliau juga ada dia punya on center lah, Plymouth Therapy. And then beliau juga ada banyak certification from international training lah. Okay, contohnya macam klasi sensory integration, okay, neurosensory motor facial therapy, okay, Ireland screening, okay, banyak lagi lah untuk Mr. Hazlan punya specialization dengan certification from international. Morning and Assalamualaikum. Encik Muhammad Hazlan, ada mau cakap something? Kita punya ni special invited speaker.
Assalamualaikum and a very good morning everyone. Rasanya terima kasih lah jemput saya untuk berkongsi mengenai visual perception lah pada pagi ini.
Okay, alright. So untuk pengetahuan semua juga, Azlan juga adalah host ataupun yang salah satu yang uruskan untuk sertifikat sensory integration kita dekat Malaysia lah. Betul kan Azlan?
Ya betul, untuk sensory integration certification program.
Okay, alright. Okay. Sebelum itu general announcement for all participants. Okay, sebelum kita start, kindly mute all your microphone to avoid interruption during webinar. And then during this webinar, if any participants have questions or inquiries, we are glad to respond to you at the end of the session. In order to do so, carefully construct your question and drop it at the Zoom chat. And then we will provide your feedback form at the end of the webinar and kindly answer and return it to us so that we can use that information for proof of attendance and e-certificate. Okay. So tanpa membuang masa, kita jemput invited speakers kita, Encik Muhammad Hazlan, untuk talk about introduction in visual skill assessment in children. Okay, silakan Mr. Hazlan.
Okay, sebelum mula dengar suara saya?
Dengar.
Dengar.
Okay. Okay, Assalamualaikum and a very good morning. So my name is Muhammad Hazlan. I'm an occupational therapist. So today we are going to discuss about a very special topic, which is regarding visual skills in children. But today I would like to be more specific to talk about the introduction in visual skills assessment in children. So later on the next slots, you will learn how to administer one of the visual perception assessment. But in my discussion is mostly to talk about what are the things that we need to consider to before we choose or before we administer any kind of visual perceptions or visual skills assessments. Without further ado, let's look at the slides. The next slides. Okay, so before we go further to understand deeply about visual perceptions, we must make sure that we ourselves have a very good understanding, a deep understanding about perceptions and occupations, because in general the meaning of perception is the manner in which we take in information from the environment. Number one, from the environment and from our own bodies. But when we talk about vision, it is mostly from the environment. It is a far sense receptor, right? The eye. Perceptions is a process of receiving raw sets of details from the environment. When we were an infant or a baby, we do not have a good understanding about the thing that we are seeing. Most of the thing that we see is basically to look at the characteristic of the objects, the shape of the objects, the color of the objects, the shades of the objects, and all the other details that we see. To have a perceptions, all these sensory informations, these raw sets of detail, will later be processed in our central nervous system to create a perceptual concepts. This is where the communication between occipital lobe, which is control most of the visual perceptions processing, will communicate with other part of the brain for us to develop our perceptual concepts. So we know about object use, language, signs, and then when we see something that is very beautiful, it affects our emotions and everything. This raw set of details is also important because visual skills do not process all the information by itself. It requires another parts of the brain that control, might be the vestibular system, the somatosensory system. So all this kind of communication will later develop a movement scheme formations. It is very important. And then we know that as an occupational therapist, we always talking about occupations. We always talk about engagement, meaningful participations. So can you imagine from just a raw set of details, we can process all this information to create perceptions in our mind, and then we can engage in a meaningful experiences and engagement in an occupations. So if you can look down there, I write sensation. From sensation, it develop a perceptions, and then we must use that information in our brain to allow us to participate with the activity that we do. As like BJSD said, that the perception is actually the use made of sensation. Whenever you receive a sensation and then you create a perception, but you do not use it to interact with your environment, it is not really called as a perceptions. You know, sensory, and Aries also said that sensory integration is the organization of sensation. The sensation must be organized, and then it must be used. So all these are related between each, one another. Okay, the next slide. I cannot say. Okay, so we have a basic understanding about perceptions and occupations. So now we are going to look deeply about visual perception process. Visual perceptions is a total process. When it says as a total process, it means that an exact definitions of what is visual perceptions is not really there, because it is a very complex process. It involves multimodal communications. If you can look there, it said that it is responsible for the receptions of sensory functions. So it involves receptors, and also later on, it also involves the cognition, the specific mental function of visual stimuli, which is our central nervous system. So if you look at the linear continuum there, you know, is everything started from our eyes, you know, the oculomotor control, the muscles of the eyes, you know, superior rectus, inferior rectus, and everything. It started from there. All these muscles is responsible to allow us to receive all this information from the environment efficiently. And also, we also have the lens, the ciliary muscles who control the lens, you know. So it is not really talking about everything in the brain. It's also talking about the receptors, the muscles, the eyeball, the lens, and everything. And then we go further to sense all this wavelength of light to our cones and rods receptor, and then to be sending in a form of electrical stimulations to the occipital lobe to be processed in the Brodmann 17, Brodmann 18, Brodmann 19, the area of the brain who control the visual perception processing. And then after that, at the end of it, it will communicate with other part of the brain to create a meaningful informations for us. Okay, next. Okay, if you can look at the slides here. Okay, the sensory reception occurs in the eyes, but the recognition, the perception occurs in the brain. If you look at the first picture there, you know, there is a slime, and the second picture, the child hold the cube, right? So we use our eyes to see at the objects that we are controlled, that we are touching. So if you look at the slime, it is quite irregular in shapes. The color is green. It is kind of flowy in movement, and then it doesn't have a very fixed kind of shapes. But the second picture, the cube, the sides is almost similar, and then the shape is quite stable and everything. So through our visual, from our eyes, when we see at things, okay, and then we process it in the brain, then it will provide a response on the way how we are going to control and manipulate that objects. You know, if we hold a slime, we need to put our hand at the bottom of the slime so it is stable for us to control. The cube can be hold from the top, right, because it is stable. And also visual informations that we receive. If you look at the third picture there, that is a picture of a Switzerland, the blue sky, the greenery, the lakes, and everything is so relaxing. So how visual perception is also could provide an emotional response to us. Okay, next. Talking about visual perceptions, there is a lot of things that will come to you. There is a various kind of manifestation that will come to you to say that they are actually have visual perceptions or visual skills problems. Everything that the child have in terms of a problem is not just what is on the paper. So to do the administration, to conduct an assessment regarding visual skills, there is a lot of things actually that we need to consider too. If you can look at the picture there, the first is emotion, ideation, cognitive, social, behavior, motor, sensory, and physiology. There is a lot of things. A child could come to you with an emotion difficulties. For example, the parents might be saying that the child is always crying, the child have a poor self-regulation issue, especially when doing academic tasks, or the child might have an ideation problems, when they learn about something that is related to visual perceptions, they cannot come up with any kind of idea how to start to make a movement that require the visual perception skills. And the child might have a cognitive function, might be the parent might saying, or the teacher might saying that the child has reduced attention, right? Easily distracted. So all of this will come with different kind of other developmental component. But the thing is, when we do an assessment, at the end, we will find that somehow it is caused by a visual perceptions or visual skills difficulties. So we need to be really careful to identify what are the causes that, what are the secondary causes that is actually come from visual perceptions difficulties. Okay, next. Okay, these are the components of visual skills. There is a lot, talking about only the process of the receptor and the process of the occipital lobe. This are the list of the visual skills component. The first is the skills of making the eyes in a convergence movement, the divergence movement, the accommodation skill, the pursuit skills, the saccadic skills. There is a lot of things that happens in our eyes, okay, the muscles and everything. And then the depth perception, figure ground, form constancy, position in space, and spatial awareness, and etc. are the things, are the visual skills that happen in our central nervous system. So we must make sure that we really understand what are we assessing. Are we assessing mostly on the receptors, or we are assessing mostly on the central nervous system processing? Because visual skills component is too wide. And then after that, we also need to know, like I said just now, that visual perceptions do not work by itself. It requires an integration with another kind of components. So there is, I will tell you on the next slides after this about what are the things that we need to consider to relate visual skills with another kind of development. So we know that it is not just all these components that we need to assess, but there is another things that we need to look on, okay? Okay, next slide. Okay, these are the things that we need to really understand, okay? So for example, if we choose an assessment that assess visual perceptions, and then when we have fully administered that assessment and the result seems not really helping us, so what should we do to investigate further, right? So from this hierarchy, when we know about this level of complexity, the sophistications of this system, we will understand whether we want to go going down to the base of the pyramid or going up of the pyramids. For example, if you look at the base, the basic foundation is talking about the oculomotor control, the visual field, and the visual acuity. This is all are the receptors ability, the eye, so it talks about the structure, it talks about the motor functions, okay? And then there is attention and alert and attending. It talks about a modulation process, a sensory process, They doesn't talk about depth perception, they don't talk about visual closure, they don't talk about figure ground, they talk about the receptors. So whenever you want to assess the child, you must start from the bottom. So you need to eliminate the bottom part and then identify that all this bottom part is already settled, then you can go up and up. Okay, so if you choose an assessment directly, you know, to assess about child might be visual cognitive function or something, or but the child really has a problem in the receptors, so you are not really assessing the component that the child having difficulties with. So going up, we have primary central processing. This is the pattern recognition, the visual memory, and everything is getting more complex and complex. And then when we have developed our visual perceptions ability, and then we will try to associate that information to another central processing. That is where the adaptation through vision is occurs. Okay, so it is a process. You must start from the bottom and going up and up and up. Okay, okay, next. Okay, now we have an understanding about, our visual perceptions or visual skills mainly involve two components, the receptors and the central nervous system. And then we know that based on the hierarchy, or there is another thing that I need to look on instead of just focusing on visual perception skills. And also we have the basic understanding about how perceptions is related to occupations, right? So now I'm going to suggest to you a key consideration in evaluating visual skills. Some of these are based on my clinical experience in looking at child. What are the things that I need to emphasize? What are the things that I need to focus on before I administer the assessment? Okay, so I will share with all of you here. Okay, the next slide. Okay, it is a very common then when we receive complaints from parents saying that my child handwriting is too smudgy, my child just hardly to understand calculation concept, easily to get dizzy after his badminton training, you know, writes in reversals. This is very common. My child always miss his catch during hockey training. My child easily to get anxious in place full of people. So some might ask, oh, my child easily to get anxious in place full of people. Is it really related to visual perceptions? Somehow it is, somehow. But to justify, to identify, it is really is, we need to administer the assessment, okay? So that's why I said that the child might come to you with emotional difficulties, anxious, but I think it is coming from a visual perception difficulties, okay? Next. Okay, we look at the word there, the malformations of letters. Some of us will directly saying that, oh, malformations of letters, I think this is because of visual perception skills. So it is always end up there. You know, there is no further investigation to justify what type of visual perception that the child might has. So if you look here, the upper part, malformations of letter might be because of visual perception issue. And then when you further investigate, you find that the oculomotor difficulties is the thing that you need to further investigate. And then after you have administered the assessment, you find that the child have a convergence and divergence skills deficit. You know, it is also can occurs when you say that the child have a malformation of letters, also visual perception issues. And then when you administer using a visual perception skills, you find that the child has a visual form issues, mostly mainly on the visual closure. You can see here one problem could be manifest by two different kind of difficulties. So whenever you want to provide an intervention, you must understand that it is not that we're giving a child a puzzle, we're giving a child any kind of task by assuming the child has a visual perception issues, you know, because both of these problems will require different kind of interventions. Okay, next. Okay, number first, okay, that I want to emphasize here, always investigate the nature of the visual behavior. So how we are going to investigate this visual behavior, right? Because we have zero information, the parent do not tell us anything yet, so we have zero understanding about the child. But to investigate, when we talk about visual perceptions, the thing that we need to focus, whether we want to talk about behavior focus, something that the parents always come up with from their mouth, talking about child refusal, lack in participation, tend to withdraw, very dependent. So all these are a behavioral focus kind of an interview, addressing the difficulty about a behavior, you know. And then sometimes we ask the parents about the parent strategies. What are you doing to your child when you've identified that your child has this kind of, your child shows this kind of behavior? So the parents started to say that, oh, so I asked them to compulsory to complete the homework, keep addressing the fault, salah, this is wrong, this is wrong, this is wrong, right? The parent strategies, more on a behavior kind of techniques. And then in the contextual difficulties, the parents said that this misbehavior will occur every time during completing homework. Are you going to go further deeply to understand about child visual perceptions by addressing all these kind of informations, or you want to go to your visual skill focus to talk about the eyes? Are your child always rubbing the eyes, or the child always shows a tired eyes, watery eyes, hardly to sustain visual engagement? Something that talking about the eyes ability. You are the therapist. You sometimes, when the parent do not have all this word to state to you, you sometimes need to say it to the parent. Parents, do you see that your child always rubbing their eyes and everything? Your questions must, to investigate the visual behavior, must a visual skill focus. Okay, the parent strategies, and also will say that, oh, my child went to meet with the optometrist last week, and then the result is still not coming, it's not ready yet, and everything. So we are going through that, you know, talking about visual skills, visual perceptions, and have you done any lighting modification in the room for your child to learn and everything? So we started to go there. Okay. Or you want to go to another development focus, this is talking about the emotion, the motor. All these are the secondary kind of manifestation. As I said, you need to go to the basic understanding, the visual skills, which cause emotion and motor. If you go directly to the motor and emotions, you will not find a really good understanding about the child visual behavior. Okay, so next. Ada tak? Next slide. Okay, so identify patterns of occurrence. When we already understand about, when at number one, we have investigate and we inquire all the informations from the parents, this is where we need to start to understand about the patterns of the occurrence. Is it a selective or non-selective? Is it happen to a specific type of task, time, environment, equipment, or it is a non-selective? It can happen at any place, any type of task, any equipment, any environment, any time. So we need to further understand about this. So type of task, for example, does the child has a visual skills or visual perception problems when it involves sedentary activities, or just an active movement, unstable surfaces, hanging equipment? What is it? We need to specify our findings. And then the time, is it the child will show visual perception or visual skills difficulties before or after any specific task? Or is it related to activities which is time consuming? You know, when the child is asked to do all the homeworks for 2 hours, there is children who is forced to do homeworks for 2 hours consecutively. You know, this is very time consuming. And then we know that the oculomotor control is not there, it's not really good. And then there is where the patterns exist, you know. And then also we need to further evaluate about the child environment, about the home, school, room, open space. Where is the place that the behavior, the visual behavior occurs? Okay, is there any changes if there is adult involvement? The equipment that child choose, the manipulative in nature, you know, equipment to support visual stability, you know, is there any kind of tools that we use to help the child, or there is no? Okay, okay. So number 3, the next slide. Okay, number 3 is other developmental history. We, as a therapist, we must always make sure that we ask other developmental history about the child, which might contribute to child visual skills difficulties. With my statement just now, I said that arousal could affect child visual perceptions. So I really need to, if from my interview, I think that the arousal is the thing that might cause the child to have this problem. I will further inquire all the questions from the parents to talk about this. Okay. Number 4, interview or novel environment or task. Does our interview is based solely from verbal response from the interview or based on information from novel environment or the task? We need, in my experience, I always make sure that me myself, we do the clinical observation through novel environment. I want, if the parents said that, okay, my child doesn't want to climb this stairs, the child doesn't want to jump from up here to down there, the child doesn't want to sit on the swing and everything, the child doesn't want to do their homework and everything, the child doesn't know how to catch this ball. I want to make sure that all this information is true. I will do it by myself, and then I will clinically observe, is it really related to visual perceptions? Okay, you doesn't need to take 10 activities. You can start from 2 to 3 activities and then go further and investigate about the child conditions. Number 5, does traumatic event contribute to these difficulties? Can you imagine nowadays that when children are sending to kindergarten or preschool, start from the age of 3 or 4 years old to learn about all the academics, you know, to know all the alphabet, to know the numbers and everything. So started from there, if they have a visual perceptions, you know, at the same time they are being diagnosed with specific learning difficulties, they will find they will have a very struggle environment for them to know all that academics content. So when they are up to 6 years old, being experienced from 3, 4, 5, 6 for 4 years, the child has been introduced with an environment that is forcing them. And then when they come at you at 6 years old, they will interpret it as withdrawal and refusal. Will come up with unsettled modulation. They will come up with you with a secondary diagnosis related to mental health condition, anxiety, you know, conduct disorder might be, you know, we don't know. We need to further investigate about that. But traumatic event, when they started at the age, a very young of age, we need to understand about that traumatic event before we further evaluate about the visual perception skills. Okay, next. Okay, number 6 is developmental age of visual skills. We as a therapist, sometimes we receive comments from parents saying that, oh, my child is 4 years old, but he still doesn't know the ABC, the letters, right? But as a therapist, you make your own judgment. Does the child has the ability perceptually to understand, to memorize A to Z at the age of 4 years old? If it is not, then why should you justify that as a problem and then you investigate about that? You doesn't need to, you know, you just tell to the parents that, okay, this is not at the age of he or she required to or be able to memorize all these informations, you know. So the parents, in my experience, could sometimes influence the diagnosis, you know, when they come up with all the problems that the child has, and then the child is very early to be diagnosed with any kind of developmental issues. So when the child is diagnosed with that, the child need to follow that kind of program or therapy, which is, for me, the child doesn't need to go there. The child doesn't need to be trained for that. It is not ready for them. Their central nervous system is not there. Their oculomotor control is not ready and everything, okay? Number 7 is comprehensive evaluation. This is really, really very important. We need to do a comprehensive evaluation. If you cannot go for a standardized assessment, a very long standardized assessment, you need to might be choose 1 or 2, the subtests, or you can do a clinical observations. This is to confirm, to specify, to measure, to compare all the data that you have. As we know that all learning ultimately takes place in the brain, it is often forgotten that it is through the body, the eyes, that the brain receives the sensory information. So the assessment must be about the receptors and then the brain, okay? Okay, next. This is why I said, number 8, both standardized assessment and clinical observation must be used. We must use all this assessment, We have performance-based assessment which assess different component of a child. For example, DTVP, TVPS, and BBT might assess a component of visual perception skills, and some of assessment might assess motor integrations, visual motor integration skills. For example, SPM or sensory profile, it assess the child sensory processing that is related to visual. Is it when the child unable to see a bright light? Is it because of the lens, the ciliary muscles is not very well works, or the oculomotor is not very good in moving the eyes to look at the other parts of the environment, so they do not be exposed to the light very consistently, or the island screening, which talking about the colors that might affect the child visual perceptions. There are a lot of different kind of performance-based assessment. So we need to be familiar to get ourselves familiar with all this assessment. Then which the child comes to you with a specific kind of problem, you can choose which assessment assess what. Okay. And then you also need to do the occupational based assessment within PDSFA, all this assessment to further investigate, does the child visual perception skill could affect another kind of occupational participations. Or if you can choose a specific contextual assessment, if you think that the significant problem is mostly because of the handwriting, so do the master handwriting assessment protocol, or if you have another assessment, just do another one, okay? This is one of the important things, the clinical observation skills. As a therapist, even we need to rely on the standardized assessment, we must understand that clinical observation is very, very, very crucial, okay? We need to, so these are the list that you can pick up. ARIS clinical observation, it talks about oculomotor control and visual perceptions, background settings, sports, how the child's workbook, the organization skills, the oculomotor evaluation by Dr. Teresa May Benson's. There is assessment talking about the receptors. And number 9, using updated dysfunction patterns, as in sensory integration praxis test, we have a pattern, we call it as a visual dyspraxic. In DTVP, we have a patterns of visual motor integrations. So it is making you become easier to work with the child when you provide the intervention based on the pattern of this dysfunction. Okay, if the child comes, when you do the assessment, you find that the child has a visual praxis patterns, you just need to work mostly on the praxis side. If the child comes to you with motor reduced visual perceptions, you need to mainly focus on activities that talks about or provide the intervention mostly on the visual perception activities. So the pattern is very important. How to know this pattern? You must do a lot of reading, do a lot of research to understand what are the current patterns that occurs from the assessment that you choose. Okay, next. Ya. Boleh tak next? Okay, so this is the last one. Okay, number 10. Okay, we know that we assess the oculomotor control. There are assessment to talk just about the oculomotor control. There are assessment to assess the visual perceptions, and then we go further. We go further to understand about any kind of associative processing related to visual skills. If you can see there, they are reflexes. We call it as a vestibulo-ocular reflex, pupillary light reflex, pupillary dark reflexes. All these, for example, number 1, vestibulo-ocular. This reflex state that there is a connection, okay, neuroanatomically and neurophysiologically between the oculomotor control and the vestibular system. So does the child, when you know how to administer the assessment, then you can further justify that, oh, I found that the child has a reduced vestibulo-ocular reflex, or the child has an increased vestibulo-ocular reflex. Then from there, you know that you as a therapist need to provide the intervention includes the vestibular activity. That is a very interesting when you know what assessment that are available, what kind of connections that our eyes has to do with another part of our developmental component, and also we also have vestibulocholic, vestibulospinal, all this kind of neuroanatomy and neurophysiological physiological processing. vestibulocollic and vestibulospinal related to the extensor muscles of the neck and the back and everything. So we need, when we want to stabilize our eyes, we need to have a very stable posture, right? So when you do the assessment, you find that, oh, this child, during the sedentary activity, okay? During the sedentary activity, when you assess the child, you find that, okay, there is nothing much that I can find that the child will have a difficulty in visual perceptions. But when the child is moving, I can see that the child will show a very significant problem in visual skills. When you assess vestibulocollic, vestibulospinal, and other reflexes, you identify that, oh, all the results from this assessment is also very low or very high. So are they related? So when you want to provide interventions, then your intervention will become more widely to cover different kind of component, associative component, okay? So one of the assessment that you can use is EASY, the postural control evaluation, the post-retinal nystagmus, the DTVP, etc., etc. There is a lot of things. It's just that you need to get familiar with all this assessment. From there, you will have the ability to structure. When the child has this one, you want to choose which subtest, okay? So next slide. Okay, I think that is a few points that I can share with all of you about how to prepare ourselves before we choose an assessment regarding visual perceptions difficulties. Okay, I think that's all.
Okay, thank you Mr. Hazlan. Rasanya selepas Hazlan present tu rasanya macam membuatkan yang kita sebagai OT perlu banyak consider pelbagai faktor sebelum kita assess visual perception client lah. Okay, and then saya dapat conclude yang kita perlu juga do a lot of reading and research lah, sebab kita perlu kaitkan teori, okay, basic foundation pasal visual perception untuk membantu kita consider visual perception dalam clinical practice. Betul Azlan? Okay, and then sebelum kita move kepada next topic, ada beberapa soalan yang boleh tanya kepada Mr. Hazlan. Kita bagi sekejap lah masa untuk tanya, sebab Mr. Hazlan ni kita punya our special invited speaker, so rugilah kalau tidak tanya soalan dekat Mr. Hazlan. Kalau ada soalan boleh juga letak dekat chat Zoom dalam ni lah, okay? Tapi Mr. Hazlan, saya ada soalan. Boleh satu soalan Mr. Hazlan?
Boleh.
Boleh? Okay. So kalau macam kita OT untuk
boleh.
Tingkatkan skill dalam sensory integration assessment, dia ada training ataupun certificate. So kalau macam OT tu dia nak untuk lebih ada pengetahuan ataupun lebih ada skill dalam visual perception, ada Encik Hazlan boleh suggest mana-mana certificate training ke ataupun apa untuk ni lah dalam visual perception ni?
Saya tak berapa clear dengar. Boleh kalau type lagi senang kot untuk saya ni. Cuba boleh type tak?
Tak apa. Nanti kami akan type balik.
Okay.
Selamat pagi presenter.
Saya tak ada berapa dengar tadi soalannya sebab putus-putus.
Boleh saya tanya soalan satu tak?
Boleh tanya Prof.
Terima kasih. Well done, presenter. Very good presenter.
Thank you, Stan.
Thank you very much. I'm just wondering lah, because we have many standardized assessment and clinical observations like performance-based, occupational-based, specific contact, dan clinical observation-based. From your clinical perspective and your experience lah, which one do you reckon is the best and most suitable in clinical setting, ya? And what is your recommendations? Sebab ada banyak pilihan kan, banyak pilihan yang susah nak memilih. So what do you think? Terima kasih Encik Muhammad Azlan.
Okay, so kalau kita nak memilih assessment, bagi saya semua standardized assessment ada komponen yang at the end of it dia akan provide different kind of understanding, you know. Even dia punya cara pembacaan pembacaan result dia pun sama ada raw score ke, sama ada subtest score ke, standard score dia ke, ataupun percentile score dia pun berbeza-beza. Ada assessment provide, ada assessment tak provide. Benda ni kita kena saya rasalah saya tak cakap satu assessment ni lebih daripada yang lain dan kena guna assessment yang spesifik ni, cuma kita kena biasakan familiarkan dengan different kind of assessment dulu. Let it be generalized dulu, semua assessment, and then from there kita akan learn how to pilih mana assessment yang kita nak kena fokus bila masalah ni wujud. Dia macam tu, sebab bila pengalaman saya, bila kita baca balik dia punya interpretations apa ni semua, dia akan provide different kind of understanding, different kind of informations. Ada assessment tak provide certain way of standard score, ada assessment ada. Jadi dia different. Kita kena, bagi saya lah, kita kena guna semua dulu dan baru kita boleh tahu mana yang sesuai untuk sesuatu case yang spesifik tu.
Faham, Tuan. Terima kasih, Tuan.
Okey, terima kasih Prof. Terima kasih Mr. Hazlan. Ada partisipan lain lagi nak tanya soalan? So kalau tiada ataupun kalau ada soalan, boleh drop soalan dekat Zoom chat. Okay. So tanpa membuang masa, kita move kepada next topic. Thank you Mr. Azlan.
Okay, sama-sama.
Move kepada next. Ya, kita move kepada next topic, overview and clinical utility of MVPT akan diperjelaskan oleh kita punya our next speaker, Miss Liliana Davina. Okay, silakan Miss Liliana.
Yeah, thank you, Anam. Okay, hi everyone, I'm Liliana, as introduced by our moderator before. Just now, Mr. Hazlan already briefed you all on evaluation of visual skill. So I hope everyone already have some ideas on my topic afterward. I think maybe some of you guys are already familiar with previous version of MPPT, but today I'm gonna brief you guys on the overview and clinical utility of the latest version, that is MPPT-4. So let's start with the next slide. Okay, in general, what is assessment MPPT-4? Okay, MPPT is one of the most popular visual perceptual assessment in OT and driving rehab in US and Canada. Okay, but then MPPT-4 is the latest update of the previous MPPT assessment, where this new edition only retained 45 items from 65 items used in previous MPPT-3. Okay, this assessment is an individually administered assessment of visual perceptual skills commonly used in our everyday activities. Okay, and then MVPT-4 is an assessment that use multiple choice format and no motor responses are required to answer. So this explains why the name of this assessment is motor-free visual perception test. Okay, our patient can just point on the correct answer. They don't have to draw or write the answer for us. Okay, other than OT, this assessment also can be used by optometrists, psychologists, special education teacher, and other clinicians if they are interested and have been trained to assess visual perceptual abilities. Okay, so Our MBPT-4 assessment assesses 5 types of visual perceptual abilities that are spatial relationship, visual discrimination, figuregram, visual closure, and also visual memory. Okay, what do we have in the MBPT-4 test kit? Okay, we will have 1 manual booklet, 1 test plate, and 25 reports form. Okay, that's all about MBPT in overview. So we go to the definition of MBPT-4, visual perceptions. Okay, I'll explain the definition based on the author of the assessment lah. Okay, so based on him, visual perception according to ICF, and it falls under body function. Okay, it is described in ICF that visual perception is a specific mental function of recognizing and interpreting sensory stimuli. According to WHO, this mental function is involved in discriminating shape, size, color, and other ocular stimuli. Okay, now take a look at the picture here. What are we seeing here? Apa kita nampak? Okay, you guys can see dalam gambar tu ada green tree, right? So here visual perception refers to the brain ability to make sense of what our eyes see. Because of visual perception ability that we have, we are now seeing a green tall tree, okay? Not short yellow tree, okay? And it reminds us that we are now in park or forest because there are trees everywhere. Okay, bear in mind that visual perception is not the same as visual acuity, which refer to how clearly a person see. Okay, kadang-kadang budak tu boleh ada 20/20 vision, but still have problems with visual perceptual processing. Okay, next. Okay, as what Mr. Hazlan mentioned before, visual perception relates to sensation and cognition. Okay, therefore, this assessment measure other important visual processing skills that are conceptually positioned in an area above sensation and below reasoning. Okay, the 5 ability mentioned before are those important visual processing abilities. Okay, now what are those 5 different abilities that I mentioned before? Again, apa dia? Yang 5 visual perception abilities tadi. Okay, so the first one is spatial relationship, visual discrimination, figuregram, visual closure, and also visual memory lah. Okay. Now, let's take a look at all the 5 abilities now, one by one. Maybe I can explain those abilities in Malay and give some examples of activities so that you guys can understand more. Okay, the first one, spatial relationship. What is it? Okay, spatial relationship is an ability to orient one body in space and to perceive the position of objects in relation to oneself and to another object. For example, figure reversal or figure rotation. Okay, imagine sekarang kita tengah tengok nombor 5 yang upside down. Macam mana you tahu tu nombor 5 walaupun kedudukan dia dah tunggang terbalik? Okay. All thanks to our spatial relationship ability lah. Okay, and then secondly, visual discrimination. It is an ability to discriminate dominant features of object. Okay, ianya adalah keupayaan kita untuk membezakan kedudukan, bentuk, warna dan huruf. Contohnya boleh kita lihat dalam aktiviti yang macam find differences in the picture. Okay. Third one, figuregram. In the other hand, is a form of visual discrimination that involves the ability to distinguish an object from background or surrounding object. Okay, figuregram ni adalah keupayaan kita untuk membezakan objek dari latar belakang atau objek sekitarnya. Bayangkan sekarang you tengah tengok longgokan alat tulis di atas meja. Okay. Walaupun semua alat tulis tersebut bertindih, kita masih boleh recognisekan dalam longgokan tu ada pencil, stapler, pemadam and so on. Okay. So now you faham what is figuregram lah. Okay. I can share you example dalam kes kanak-kanak. Okay. Kalau ada masalah figuregram, apa akan jadi kepada mereka? Okay. Mereka akan berasa sukar untuk mencari maklumat penting pada papan putih, whiteboard, okay, yang penuh dengan banyak maklumat lain atau sukar untuk mencari perkataan dalam dictionary. Okay, and then visual closure. What is visual closure? Okay, visual closure here is a form of visual discrimination, and it involves the ability to perceive a whole figure when only fragments are presented. Okay, visual closure ni merujuk kepada kod bayan kita untuk melihat keseluruhan figure. Walaupun kita hanya boleh lihat cebis-cebis gambar tu je. Okay, contoh paling mudah untuk visual closure adalah activity connect the dots yang kita pernah buat masa tadika dulu. Okay, walaupun garisan ataupun dots tu terputus-putus, kita still boleh teka dengan betul yang kalau kita sambung gambar ni, ini adalah gambar ayam, gambar buah or whatever picture lah. Okay. Kalau kanak-kanak yang tak ada visual closure, ada masalah dalam visual closure, kanak-kanak tu dia tak akan dapat recognize cousin dia dalam satu gambar family. Kalau cousin dia tu tiba-tiba hari tu before that memang pakai cermin mata, but then after in the picture cousin tu tak pakai cermin mata. So budak tu dia tak boleh recognize dia punya cousin. Ataupun in reading, budak-budak tu tak boleh kenal perkataan yang dia dah kenal sebelum ni sekiranya hilang satu huruf. Okay, and then the fifth ability is visual memory. Visual memory is our ability to remember and recognize a stimulus item after a very brief interval. Okay, kita ada kebolehan untuk ingat semua gambar yang telah diberikan pada kita 30 saat sebelum. Okay, kalau budak-budak yang tak ada visual memory ni, mungkin diorang akan ada problem macam lambat menyalin perkataan atau huruf dari whiteboard. Okay, next is important of visual perception in in everyday life. Kenapa visual perception ni penting untuk kita? Okay. Based on previous study, it is stated that the relationship between visual perception abilities and function in everyday activities is subtle but all-encompassing. Okay? Bermaksud visual perception ni dalam everyday activities kita, dia tak ketara sangat. Kita tak perasan pun. Tapi sebenarnya salah satu faktor yang membolehkan kita untuk perform semua aktiviti harian kita adalah visual perception. Okay, almost all of our everyday activities sangat bergantung dengan visual perceptual abilities kita lah. Okay, kenapa macam tu? Okay, ini adalah kerana visual perception plays a role in planning motor actions, in sequencing letters and numbers presented visually, and also in differentiating between representation of the same object seen in various orientation. Okay, imagine walaupun kasut you terbalik, okay, you masih tahu kasut you tu terbalik and you boleh betulkan kedudukan kasut tu sebelum you pakai kasut tu. So tak adalah you jalan dengan kasut yang terbalik kan. So that is the an example of the importance of visual perception lah. Okay, another importance of visual perception yang I boleh cerita kat sekarang, visual perceptual skills ni akan mempengaruhi our functional mobility, termasuk berjalan, penggunaan wheelchair dan juga sewaktu kita driving especially lah. Okay, when moving through space or positioning objects, a person need to be able to judge distance and discern those objects. Sangat penting ya, visual perception ni untuk kita. Okay, for children, evidence on the relationship between visual perceptual skills and academic performance are including reading and writing. As I mentioned before lah, yang tadi tu, apa akan jadi kalau kanak-kanak ada problem dengan visual perception. Okay, next we gonna talk about population measure. Okay, MVPT assessment boleh digunakan untuk population apa? Okay, it can be used to any individual age starting 4 years, 0 month until 0 to age, even beyond 80 years. So start umur 4 tahun dah boleh guna dah MVPT assessment. And then MVPT is appropriate to be used with a variety of clinical populations such as adult participants, CP, children with hemiplegia, neurological condition, for example, spinal cord and stroke, okay, all the adults, children with and without learning disability, and also TBI. Okay, now we're done with the overview. Now, what are the general testing considerations that we should take as an examiner? Let's take a look. Okay, first, what are the qualifications that is needed for us to conduct this assessment? Okay, this assessment can be conducted by OT, psychologists, rehab specialists, learning specialists, or any other professional involved in assessing visual perceptual functioning and planning remediation activities. But please be reminded, okay, Prior to administration of the test, examiners should be truly familiar with the administration and scoring procedure of the test. It is advised that you should conduct several trial administration before attempting the real assessment on your patient lah. Okay, before you nak first time you nak buat assessment, make sure you dah buat trial dengan orang lain dulu before you start the real one. Okay. Interpretation of the result must be conducted by individuals who have formal training in psychometrics and who have full knowledge of the use of derived scores and the limitation of the test. So those are the reasons why we conducted today's webinar, to make you guys a competent examiner of MPPT4. Okay, for examinee are those among the population that I have explained before or the CP patient, TBI, all that I mentioned before, LD. Okay, and then testing time. Okay, MPPT4 assessment only need 20 or 30 minutes to administer and more or less 5 minutes to score. Okay, although the administration can normally be completed in a single session, it may be appropriate to extend the testing to more than one session if the child who shows too much fatigue to continue. Okay, testing in more than one session may also be necessary with examinees who show reluctant, resistant, or any negative behavior. Okay, if patient you tak ada motivation, okay, macam uncooperative, you should discontinue the testing and then resume on later session, next session. Okay. You can always stop session halfway and then continue on the next session lah. You tak payah nak start assessment tu dari starting point lagi. Okay, just continue from where you left before. Okay. Testing environment. Okay, testing should be conducted in an environment that is free of visual and auditory distraction. It is better if you guys can prepare an empty room without distraction around and far away from any noise lah. In addition, the child should be calm and rested. When practical, it is recommended that testing be conducted in the early part of the day, since this is a time where individuals are likely to be rested and your patient will be able to attend the tasks that require sustained concentration better. Okay. And preparation for testing. Okay, before you administer the test, please record the child dates of birth, and then you need to calculate their chronological age in years and months. Okay. Lepas tu, don't forget to write the reason for testing the child in the space provided on the recorded form. Okay. How about sitting position for this assessment? Okay, both of you, examiner and examinee, should be seated at a table or desk that is comfortable height for the examinee. Okay, make sure the table and chair are suitable for the child, and not for you. You tak apa, you meja kecil ke pun tak apa. Okay, but the child need to be seated on the suitable table and desk suitable height. Okay, and then you should be seated directly across from the child. Duduk berdepan dengan the child Put the test plate directly in front of the child at a comfortable viewing distance. And then position the test plates so that it is easy for you to turn the page smoothly. Okay. If the child usually use eyeglasses, make sure they are wearing it during the assessment. Okay. Okay. Preparing our examinee. Okay, for our examinee, this assessment in terms of child. Okay, prior to testing, we need to engage the examinee in general conversation so that our child can feel at ease. Okay, talk to the child lah. Okay, in our case with younger children, it is helpful to have their parents around to make the child feel secure. However, it is important to make sure that the parents are not going to involve in the testing lah. Okay. Parents should sit out of the examinee's side Okay, they should not prompt or interact with the examinee in any way and should not engage in conversation with the examinee during the administration of the test lah. Okay, so parents kena duduk dekat tepi senyap-senyap je without saying anything that will sabotage our result lah. Okay. Last, okay. Our macam mana dengan our examinee behavior, especially our small client? Kenapa kita kena consider waktu kita buat assessment? Okay. Okay, you guys please observe the child behavior during the administration of the test. You tengok kalau the child showing any hyperactivity, distractibility or any poor attention symptom already. Okay, and then you observe juga lah any mannerism suggesting lack of self-confidence, fear of failure and so on. All those you need to observe. And then you need to note it on the record form in the comment space provided. Okay, dekat form kita ada comment space tu, noted dekat situ. So that bila you nak interpret the result, make sure you consider on your observation during the assessment lah. Sebab mungkin such behavior are the one yang preventing the child to perform well during the assessment. Okay, kalau you dah perasan macam behavior tu dah start ada, okay, please discontinue your assessment and resume it at a later date lah, next session. Okay, I think that's all from me for the first topic overview. So if there's any question, you are very welcome to come forward lah. Okay, maybe you can write it on the chat box provided there. Okay, I'm going to pass next session to moderator Mr. Khairul Anam.
Okay, thank you Miss Lily. Okay, dalam chat box ada beberapa soalan untuk topik Miss Lily. Nanti Miss Lily boleh reply ataupun nanti kita akan bagi satu sesi untuk Lily jawab. Miss Lily boleh?
Okay, boleh.
Okay, alright. Okay, thank you. Thank you Miss Lily. Okay, so next topic, I will talk about validity and reliability of MVPT. Okay, next. Okay. Untuk kita gunakan sesuatu assessment tersebut, okay, kita perlu make sure the assessment measure to be useful or it must be both reliable and valid. Okay. So what is valid or reliable? Validity means refer to the property of instruments to measure exactly what it propose. Okay, ataupun validity is defined as the extent to which a test measure the construct it purpose to measure. Intent of test validation is to provide information that demonstrates whether appropriate and meaningful inference can be made from a test. And evidence of validity can be provided from several sources, such as the content of the test, how the test scores relates to performance, other assessment measure, and how test score relate to other criteria. Okay, all right. And then after we look the manual, okay, the author of the MVPT assess the test validity by investigating its content validity, construct validity, and criterion validity. Okay, next. Okay, content validity. So what is content validity? Content validity describes whether the item on a test represent the construct being measured and encompass the construct entire spectrum. Okay, from the author and previous research, the content validity of MVPT have excellent content validity because the MVPT content include the visual perception domains identified in past literature, and also it includes with the item with adequate discrimination and difficulty were included in the MVPT according to the age. Okay, all right. Next. Construct validity. So construct validity means how well a test measure the theoretical facet of a construct it purpose to measure. So for the author of this or the developer of this MVPT, construct validity yang ada adalah discriminant validity. So discriminant validity means the ability of a test to differentiate between two groups of participants with non-difference. Example, group with clinical diagnosis compare with a group who is clinically normal. So for this test, the discriminated validity that construct that should have no relationship do in fact nor have any relationship. The MVPT manual reports the relationship between the chronological age and MVPT standard score as evidence for its construct validity. The finding indicates that MVPT standard score was significantly positive correlated with chronological age during childhood. And it's found that have a moderate correlation coefficient lah. Okay, next. And then for its criterion validity means the MVPT compare to the test to determine its accuracy in measuring a phenomenon and refers to how well the test score compared to what is being measured. So for this criterion validity, the MVPT was being compared with the others assessment yang lebih kurang sama dengan MVPT iaitu TVPS, Test of Visual Perceptual Skills. Okay, so its concurrent validity, which means the relationship between the instrument in the question and other already validated instruments that measure the same phenomenon, and the extent of the agreement between two simultaneous measures of the same skill. So after compare MVPT dengan TVPS, so the result shows criterion validity adalah strong correlations. Okay, next. So selepas validity, okay, dalam manual juga terdapat reliability lah. Okay, reliability is the ability to reproduce a consistent result in time and space or from different observer, presenting aspect on coherence, stability, equivalence and homogeneity. So bila kita check dalam manual tu ada dua reliability yang author of MVPT to conduct, iaitu test, retest dengan internal consistency. So next slide. So dalam internal consistency, okay, to assess the internal consistency or homogeneity of the test items, okay, Cronbach coefficient alpha digunakanlah, okay, and then the average of Cronbach alpha yang dapat untuk internal consistency adalah 0.80. Kalau untuk individual age adalah 0.70 ke 0.870. So result of this show its internal consistent lah. Assessment ni adalah internal consistent sebab dia boleh diterima, sebab dia average dia lebih daripada 0.8 ataupun 0.7 lah, stable cut off point of for ability test. For test retest, next slide. Okay, test retest adalah maksud dia the ability of a test to exhibit some degrees of score stability between two administration of the same test, usually 1 or 2 weeks between the first and second administration of the test. So dalam manual tu kita dapat significant positive relationship found between individual participant test and retest standard score yang menunjukkan finding test rate MVPT ni stable over time. Okay, alright. Okay, so that's all for the validity and reliability of MVPT. Ada tiga validity dan dua validity yang terdapat dalam manual MVPT lah. So untuk current studies yang terbaru, sebab the MVPT ni adalah assessment yang baru pada 2015, so ada paper yang buat validity untuk sensitivity and specificity MVPT untuk learning disabilities. Bagi tahu MVPT ni sensitif digunakan untuk learning disabilities juga. Okay, so that's all for me about validity and reliability of the MVPT. Kita sementara tu kita boleh take 5. Boleh?
Boleh.
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 Kita take 5 sebab selepas ni kita akan move kepada topik administration and scoring of MVPT. So seperti yang sudah maklum, kepada peserta webinar yang sudah register sebelum ini, telah di-email material yang berkaitan dengan MVPT iaitu test plates, record form and manual. So sementara take 5 ni diminta untuk peserta untuk kalau dah print boleh keluarkan material tersebut. Kalau belum print silakan sebab kita sambil presenter present dia topik, kita juga akan enhance untuk MVPT ni, dan last kali kita lah. Okay, so kita take 5 sekejap ya, boleh ya?
Boleh. Terima kasih.
Okey. Semua peserta sediakan material yang telah diberi. Kita perlukan manual, kita perlukan record form dan kita perlukan test plate MVPT. Harap peserta semua sediakan material tersebut ya. Okey. Tanpa membuang masa, kita persilakan next speaker, Cik Norzi Azlaili untuk topik Administration and Scoring of MVPT. Okey, silakan Cik Norzi.
Okey, terima kasih Encik Anam. Saya perkenalkan lagi sekali diri saya. Assalamualaikum semua. Welcome to our webinar. So hari ini saya akan explain tentang administration and scoring of the MVPT 4. Okay. So without further ado, let's go to the next slide. Kalau tak kisah, saya akan buat santai-santai je. Okay, alright. So first of all, semua dah download, dah print ke you punya record form? Kita ada email record form. So if you have printed, so you can take it out and look through the assessment form. Or if you haven't printed yet, you can download for a while and then you can look at it. Tapi in the slide, I will show the record form as well. Okay. So the first thing that you need to do before administering this assessment test is that you have to calculate, you have to determine your client's chronological age. Okay, why? Because we wanted to compare with the norms that will be provided in the manuals. Okay, right. So to calculate the chronological age, first you need to write the date of the test. Okay. So on the record forms, there's a space provided, so you can just write your date of test there, and then the person's date of birth. Okay, and then you need to subtract those two dates. All right. And then when you have calculate the chronological age, make sure if you gain 15 days, do not round the months up. Okay, just leave it there. Okay, so let's go to the next slide. Okay, so these are the forms. Okay, if you can see.
Good morning. Is this clinic medic geriatric?
Sorry, come again.
Teruskan Nozi, teruskan.
Oh, okay, all right. Okay, I thought there was a question. Okay, sorry. So on the first page of the record form, okay, you can see there's a space there. Okay, date of test, date of birth, and chronological age. Okay, so like Miss Liliana had already explained to us. Okay, this assessment can be used among population from children age 4 years old until geriatric age. Okay, so more than 80 years old, you still can use this test. Okay, the next slide. Okay, look at the example 1. Okay, so this is quite easy to calculate. Okay, because you don't need to borrow from the month column or the year column. So you can just directly subtract between the date of testing and the date of birth. Okay, 22 tolak 3, you will get 19. Okay, 11 tolak 4, you will get 7. 2014, subtract 2006, you will get 8. So the answer will be 8 years, 7 months, and 19 days. Okay, and please remember, do not round up. Okay, if the day exceeds 15. Right. Next slide. Let's look at example 2. This one is a little bit difficult than the first one. Okay, where you have to borrow. Okay, the months. You nak tolak 2, nak tolak 8 tak boleh kan? So you have to borrow from the year. Okay, so when you borrow 1 year, it's equivalent to 12 months. So you're gonna have to add 12 with 2, you will get 14. So 14 tolak 8, your answer will be 6. Okay. And then the year 2013, subtract with 2004, your answer will be 9. So the answer is 9 years, 6 months, and 12 days. Okay. Let's look at another example. This one is much difficult. Okay. Because on the column day, it's a bit difficult to, it's impossible to subtract 15 and 24, right? So you have to borrow from the month column. So 1 month is equivalent to 30. This, you can use this at any month. Okay, dekat mana-mana bulan pun boleh. Even kalau tu bulan 2 pun masih 30 lah. Okay, it's standardized macam tu. Okay. So 30 add with 15, you will get 45. 45 subtract 24, you will get 21. And then tadi kita dah pinjam from the year, the month to the month dah jadi 4. So 4, okay, dia kena borrow dengan year column. Okay, so 4 tambah 12 jadi 16. 16 tolak 9, you will get 7. Okay. And then yang the year tu, of course, you can just subtract lah. Okay, you will get 10. Okay, so the answer is 10 years, 7 months, and 21 days. Okay, I'm going to give you a little exercise for you to calculate the chronological age of adik Q. So let's go to the next slide. Okay. So I'm going to give you about 5 minutes. Is that enough? Maybe less than that, okay, because this is quite easy to calculate, okay. So the date of testing is today, okay, 1st July 2021. Okay, adik's Q's date of birth is 23rd of November 2015. Okay, let's calculate. What is adik Q's chronological age? Okay. You can answer, you can give your answer on the chat, okay? Ada siapa-siapa nak jawab tak? Okay. What is the chronological age of adik Q? Ana macam nak jawab
Tak. Ada yang dah komen dalam chat box Cik Nozi. Jawapan. So kena semak jawapan dalam chat box.
Okay. Ramai dapat jawapan yang betul Okay, let's go to the next slide. Okay, so siapa yang dapat jawab 5 tahun, 7 bulan, 8 hari? Betul. Okay, anda semua hebat. Okay, so so far ada any question regarding chronological age? Do you have any question? Prof Akisan dapat salah ke? Okey, tak ada soalan Okey. Tapi saya ada soalan. Saya nak tanya dengan anda semua. Okey. What is the difference between chronological age and corrected age? Okey. Pernah dengar tak corrected age? Jap Google. Taci. Yes, okay. Puan Jannah dah jawab kat situ Corrected age kalau tolak premature. Okay. Tapi kalau let's say kanak-kanak yang kita nak assess ni, they are ex-prem babies. Do we need to consider dia punya week of birth tu for chronological age? Puan Jannah dah jawab dah dekat dalam chat. Okay, dah lepas 3 tahun tak boleh guna dah. Okay, that's right. Okay, tak perlu. Okay. But anyhow, memang ada perbezaan dah pun chronological age dengan corrected age tu. Usually kalau assessment tu dia dah memang develop for children more than 3 years old tu, dia tak akan minta dah corrected age usually. Okay, dia akan minta chronological age. Okay, alright. Let's go to the next slide. Okay, so bear in mind MVPT4 is individually administered. So make sure when you administering this test, okay, do not do in groups. Okay, it has to be one by one. Okay, there are no bezels or sealing on the MVPT. So all plates must be presented to your clients and then all item must be answered. Okay, sebab tak ada bezel, tak ada sealing. Alright. And then it's very important to follow all direction carefully, okay? Because incorrect marks ataupun incomplete administration will adversely affect the score, okay? Right. Plate tu apa pinggan? Oh, bukan. Okay, we have Prof, we have testing plates, okay? Nanti saya akan tunjuk these plates to you all, okay? Miss Liliana ada introduce us what are the tools that you will require in MVPT kan. So there are manual book of course, okay, and then you have testing plates. So these testing plates you need to present to your client, okay, during the testing. And then we also have the record forms, okay, to record all the scores. Okay, let's go to the next slide please. Okay, before starting, examiner should practice the test procedure first. Okay, same goes to any standardized assessment. Okay, it's very important to do some practice before you start to try to administer this assessment to your clients. Okay, so that the administration will go smoothly while recording the responses. Okay. And while testing, examiner must be able to see images and the direction and the record form. Okay, so image and direction dia ada dalam test plates. Alright. So let's go to the next slide. So I personally did my own practice when I have this assessment. I did it to my niece and also to my colleagues, okay, because I have to make sure that I understand how to administer this assessment tool before I perform this assessment to my clients, okay. All right, so the test plate tu, pinggan yang Dr. Prof cakap tu, okay, you have to place this test plates at a comfortable viewing distance from your client, okay, and then it should be set directly in line with the examiner, okay, so jangan tersengit, dia mesti kena letak betul-betul dekat depan klien kita ataupun depan kanak-kanak yang kita nak assess tu, okay. The examiner should be seated directly across from the examinee, meaning you have to sit the opposite from the examinee, okay? Because when you open this test plate, okay, dia ada satu muka surat yang akan facing you, okay? Those muka surat tu adalah direction, the verbal direction that you have to read to your client during the administration of testing, okay, and then the other page that facing the examinee tu ada test tu lah, okay, gambar-gambar yang kita akan tunjuk kat dia and then dia kena jawab, right, and then you need to place the record form away from the side of your client so that they would see dia orang punya marking. Okay, dia orang punya mark. So you have to sorok lah. Okay, so if on this picture you boleh nampak the examiner dia tak tunjuk dia punya record forms tu depan examinee dia. Okay. Alright, next slide. Okay, so before you start the testing, of course you need to tell the examinee some instruction. Okay, so instruction ni memang dah ada manuals. These are the standard dialogue ataupun script yang dah sedia ada. Okay, I'm not gonna read this script. Okay, sebab kita ada video. We're just gonna see how the examiner perform ataupun baca script ni. Okay.
Hello, hi, my name is Norzi. I'm an occupational therapist. Today, I will be doing motor visual perception test 4th edition, which is MVPT4. Okay, this is my client. Okay, her name is Adik Kairin. Okay, she will be doing this test with me today. Hi Kairin, how are you? Okay, great. Okay, now Kairin, today we're going to be looking at some design, okay? And I will ask you a question about each one. Some of the things you will do will be very easy and some of the things will be harder. But just try your best, okay? The answer to the question will be on the pages I show you, okay? Choose the one that you think is the best answer. You don't have to draw or write anything. You can point to the answer or say the letter that is under it. But you do have to pay attention. Are you ready, Kairin?
Yes.
Yes. Okay, let's try a practice one first. Okay.
Okay, boleh dengar tak? Boleh kan? Okay. So that is example how you can say the script. Okay. So the script tu dah memang ada dalam manual. Okay. Alright, next. Ada soalan tak setakat ni? Do you have any question? Tak ada Okay. Alright, so let's continue. Once the testing begins, okay, do not engage any casual conversation until the testing is finished. Jangan duk tanyalah, tadi makan apa? Adik suka main apa? Okay, so tak boleh. Cuba elakkan any casual conversation. Alright. And then, tapi kalau let's say there is any attempts by the examinee to engage the examiner in conversation during testing, okay, itu dah menunjukkan significant behavioral observation. Okay, so you should note that particular behavior on the record form dekat bahagian comments. Okay, so cakaplah, okay, examinee tu try to make some casual conversation during the testing. You can record that on the comments dekat page yang last kali on the record form. Okay, right. Or any kind of behavior, behavior problem lah yang you observe. Dia dah mula fidgeting ke, dia dah mula macam distracting towards any surroundings ke, you can record that on the comments. Okay, so nanti bila ada komen-komen yang ada masalah behavior during the testing tu, so bila you buat scoring tu, you have to consider that particular observation, behavior observation. Okay. Alright, when the plate booklet is open with the item page, okay, image lah, okay, facing the examinee, the direction and script to say to the examinee are on the page facing the examiner. Okay. Alright, next slide. Okay, sorry saya dekat tempat kerja sebenarnya kat hospital. Okay. Next, okay, the assessment, the items needs to be answered by our client mostly should take less than 20 seconds. Okay, tapi kalau you nampak examinee tu macam ambil masa yang sangat lama untuk jawab. Okay, you can encourage them to answer quickly. You may say, okay, which is the best answer that you think. You can guess the best answer that you think is correct. You boleh guide dia macam tu. Kalau tak nanti lama sangat nanti dia nak jawab. Okay. And then during administration, do not praise the examinee for correct answer or withhold any response for incorrect answer. Tak boleh lah bila dia jawab betul tu, yay, you tepuk tangan. Tak boleh. Okay, you kena buat remain your poker face. Okay, senyum pun tidak, masam pun tidak, marah pun tidak, tepuk tangan pun tidak. Okay. If the examinee is concerned about his or her performance, just explain. No one is expected to get every answer correct. Okay? So you have to be in control during administering this assessment, okay, to maintain the calmness of your client, from your client. Okay? Do not ever tell the examinee the correct answer during or after the test. Kot-kot lah dia tanya, macam mana tadi jawapan betul yang mana? Okay, tak boleh bagi tahu. Okay, this could affect future testing performance. Right. Next slide. Next slide, please. Okay. Alright, example provided for each type of task. Okay. So you can use the example to teach the task to examinee. So sebelum kita buat task from each items tu, dia dah memang bagi contoh dah. So contoh tu a practice session lah, I will call it. Okay, so you can repeat as many time as needed. Tapi dekat items punya task, you tak boleh repeat. Okay, example sahaja as a practice session. Okay, alright. Cuba kita pergi ke next slide. Okay, let's look at this video. Kalau dalam test plates, examiner ni tengah administering item 10, 11 and 13.
Alright, now look at this. Where is it hiding?
A B.
Okay. Look at this one. Where is it hiding?
A B.
Okay, ada soal.
Where is it hiding?
A D.
Okay. Alright, ada soalan dekat chat Saya jawab terus soalan tu So daripada Puan Nolia, skrip tu semestinya ikut dalam bahasa Inggeris je ya. Tak boleh ubah bahasa ke? Okay, this is a very good question actually. Okay. Kalau ikutkan, this is a standardized assessment. You have to bear that in mind. Okay, so dia dah memang developed in Western country and they are using English language. So it is very important kalau betul-betul lah you nak buat assessment ni dengan baik, patutnya you kena ikut guideline dia lah, prosedur dia. So you have to say it in English. Tapi bila kita guna assessment yang dah di-standardizedkan ni, in our country, it is a bit challenging. Okay, sebab in Malaysia, our primary language is not English, it's bahasa kan. So this concern, this challenge actually was raised in other few countries also. Dekat South Africa pun sama, Hong Kong pun sama. Tapi anyhow diorang masih akan translate juga. Diorang akan translate juga into their own local mother tongue language because most of their clients are unable to understand English pun. Okay, but saya punya pendapat lah, kalau let's say you dah translate into bahasa, you mungkin boleh komen sikit dekat ruangan komen dekat test record form tu, okay, because you need to take that as a consideration masa you buat scoring interpretation. Kenapa? Sebab bila you dah translate tu, apa yang kita translate tu kita tak ada bukti lagi. Is it standardized dah? Ada reliability-nya ke? Okay, yang translated version yang you dah tukar tu. Okay, so kena hati-hatilah. Tapi kalau you memang nak guna assessment ni for macam contoh research purposes, yang tu memang you tak boleh ubah. Okay, kalau tak nanti hilang dia punya apa tu psychometric semua tu. Okay, okay, let's go to the next slide. Okay, let's try few of the items test. So kalau ikutkan dalam activity
maaf,
ni
Nozi.
kita ada. Yes.
Maaf Nozi, tadi ada satu peserta raise hand, Ishak Magrajka, tak silap. So kalau dia ada soalan boleh tanya Nozi sekarang.
Okay, you can chat dekat chat box Okay, what if the client got a language
kalau
barrier?
tiada kita boleh teruskan lah.
Okay, there's another question. So question ni pun lebih kurang sama dengan question Puan Nolia tadi. Yes, it's going to affect the scoring. Kan, dia most probably, bukanlah most probably, probability akan affect scoring tu kalau kita dah translate. Sebab kita, we are unsure bila kita dah translate into bahasa, we might the client might misinterpret apa yang kita dah translate. Okay, of course lah dia akan affect dengan scoring tu. Okay, tapi itulah, ini adalah challenge yang kita bukan setakat di Malaysia saja, tapi other countries pun are having the same challenge. Okay, tapi diorang translate jugalah sebenarnya, because kalau tak mustahil diorang nak administer this assessment sebab klien diorang tak boleh nak faham bahasa Inggeris. Okay, tapi you have to consider jugalah apa yang you translate tu might affect dia punya scoring. Okay, so saya punya suggestion, since we have the comment section dekat kita punya record form tu, okay, you have to tulislah kat situ client are unable to understand some of the instruction in English. Okay, some of the instruction was translated, so you boleh comment dekat situ. Okay, so this is a guideline lah for you, another consideration for you to take masa you nak buat scoring interpretation nanti. Okay. Okay, how to maintain child's participation throughout the test, especially when the child appears restless. Should we stop or encourage to accomplish the task? What's your opinion? Okay, tadi rasanya Miss Liliana ada explain dah, kan, masa consideration to be taken. Of course ada certain child yang ada challenging behavior macam ADHD kan, dia dah macam way too fatigue untuk continue ke, ataupun dia dah start hyperactive, showing hyperactive behavior ke, you boleh stop and then you boleh continue this administration into another day. Boleh, tak ada masalah. Okay, kalau boleh siapkan into one day, you siapkan. Tapi kalau let's say tak boleh, then you boleh continue on the next session. Okay, sebab kalau you continue juga, the child might not be able to give you his might not be able to show his true abilities, his true visual perception skill during the test. Okay, boleh stop, tak ada masalah. Okay. This goes to geriatric punya patient jugalah. Okay, if you are doing geriatric. Okay, now let's try few of the item test. Okay. Saya tak ambil semua, saya tak ambil kesemua 45. Saya tunjuk sikit je lah kan, kalau tak nanti drag masa. Okay, this is item 3. If you have the test stick with you, you can open to item 3. Okay, so direction tu, it says look at this. Okay, and then you need to point dekat gambar atas tu. Okay, now find the one exactly like it here, and then you need to point, okay, to the bottom row of the figures. Okay, so waktu you administered this assessment, you can use your finger to point out lah. Okay, so Okay. Ada nak jawab ke? Cuba jawab. Siti Nur Atika, dia jawab C. Okay, let's look at the answer. Next slide, please. Yeay, betul sih. Tapi you tak boleh puji macam tu tau. Okay, you tak boleh puji. Maintain your poker face. Kalau you buat dengan klien you tak boleh puji lah. Okay, so bila the examinee might say C ataupun B ke A ke, okay, dia boleh cakap or point it out. But make sure bila dia point tu, you need to ask again, yang mana satu, yang ini ke yang ini. Sebab kadang-kadang it's a bit confusing kan bila dia point tu, kita tak tahu the exact answer yang dia point tu dekat mana. So you have to, you can ask the client untuk kepastian lah. Okay, and then dekat record form tu, you kena bulatkan, okay, bulatkan C. Okay, next session pula dah, next slide. Okay, item 8. Okay, dia kata point to the figures. Okay, you can point to the figures and say which one of this is different from the others. Cuba tengok. Cuba teka yang mana satu ya. Maknanya boleh tunjuk juga ya, tak semestinya boleh cakap betul. Okay, contohlah macam kanak-kanak yang tak kenal huruf, dia tak kenal lagi ABC apa semua, so dia boleh tunjuk. Ada yang jawab C, ada yang jawab D. Okay, let's look at the answer. Apa answer dia? C. Okay. Boleh nampak? That's why you kena practice, okay, before you nak administer this assessment to your client. Okay, next. Item 13. Okay, look at this. Where is it hiding? Oh, ramai jawab D. Okay, let's look at the next slide. Apa answer dia? Yeay, pandai. Tapi ingat jangan puji tau. Kan? Jangan keluar pom-pom punya bola tu, tak boleh. Okay, waktu administer tu, you have to maintain your poker face. Okay, and then you have to circle the correct answer dekat record form. Okay, item 17. Okay. How many squares do you find here? Macam main game kan? Jangan puji. Okay, maintain poker face. Boleh trace guna jari tak? Boleh. Okay, kita boleh bagi klien tu trace guna jari. Tak ada masalah. Okay, let's look at the answer. Dah boleh jawab? Ramai yang jawab 5 Okay, so let's look at the answer. Apa jawapan dia? 9. 9 sebenarnya. Okay, termasuklah ada overlap square tu kan, menjadikan a small square. Itu pun counts. Okay, itu pun count. Right, so kalau yang dah ada manual tu nanti you boleh go through and then do some practice dululah. Okay. Now item 20A. Okay, yang ni saya tutup dulu gambar dia sebab saya tak nak bagi you tengok lagi. Okay, because this one is actually we are going to test our client's visual memory. Okay, So dia ada 20A dengan 20B stage tu. So 20A tu you estimate about 5 second. Okay, you akan present this picture of roughly about 5 second. And then barulah you akan turn to the next page which is 20A, 20B. Itu adalah pemilihan answer dia lah. Okay, so I'm going to give you 5 seconds to look at this picture. Next. 1, 2, 3, 4, 5. Okay, next slide. Okay, now find it here.
Assalamualaikum dan salam tugas
Sekejap Okay, alright. So let's look at the answer. Sorry, ada pengumuman tadi. Jawapan dia D. Okay, and then when if your apa-apalah respond that you get from your client, you need to circle at the record form. Okay, let's try again. Dia makin lama dia akan makin susah lah. Okay, untuk example 31 until 36 ni, dia punya direction dia agak panjang. Okay, so let's read the direction. Okay, all of this you need to point to the bottom row, to the pictures lah. Okay, are the same figure. 3 have been turned so that their heads are in different places, but one has been flipped over like a pancake, so it faces the opposite direction from the others. Okay, yang ini you boleh prompt using your hand. You akan boleh buat macam tu lah. Macam pancake kan. Macam tu. You boleh prompt macam tu. Okay. Which one has been flipped over and can't, sorry, saya tak nampak ni. And can't be turned to face the same direction as the others. Boleh faham tak direction tu? Buat betul Putrajaya buat pengumuman. Betul. Okay. Chong Kong Wai dia jawab A. Maknanya korang faham soalan tu. Sebab saya pernah administered this assessment, yang bahagian example 31, 36 ni ramai yang get confused. Okay. So kalau let's say you nampak client you confused, okay, let's go to the next slide. There is another script yang you boleh baca. Itu dia. If the examiner can't see the difference between the figures, you may say 3 ducks were turned so that their heads are in a different position. If all were turned more to put them back on their feet, 3 ducks will face the right. Okay, only 1 duck, if it's put back on its feet, faces the left. Yang ini you boleh bagi klien tu pusing the page to illustrate arah dia punya beak tu, face tu. Okay, boleh. Okay. Alright, so like I said, example ni you boleh repeat as many time needed. Okay, tapi dekat items you tak boleh repeat lah. Okay. So, jawapan dia apa? Next slide. Okay, jawapan dia is actually A. Okay, untuk example, you still kena circle juga. Okay, circle saja dekat example tu. Tapi masa kita nak kira the total score nanti, kita exclude example. Kita just kira a correct response from item sahaja. Okay, exclude the example. Next slide. Kita tengok item 36. So item 36, the arahan tu sama macam tadi, example tadi tu. Okay, but this time no further explanation are permitted. Okay, so you hanya akan bagi arahan which one of this has been flipped over. Tadi dalam example tadi tu kita dah practice kan. So item 36 and so on, dah tak perlu explain panjang macam tadi dah. Okay, ada yang jawab D. Oh, D. Okay, let's look at the answer. Cuba pergi next slide. Yeay, betul. Alamak, terpuji pula. Patutnya tak boleh puji. Okay, next slide. 37. Dia orang lidi kan. Okay, if we finish drawing this, you have to point to the figure on top. Okay, and then move any of the lines. Okay, which one would look just like this on top? Sorry, tadi you have to point at the bottom figures. C, okay. Veronica Chong dia jawab C. Okay, so let's go to the next slide. Okay, jawapan dia C. Okay, next. Item 42, I think this one is the last one. Okay, all right. If the lines were filled in, which figure would look just like the top one? Okay, let's see what is the correct answer. Tu dia. Okay, alright. Okay, let's go. Okay, next. Saya dah tak ada dah kot. Okay, itu je. Tapi kalau ikutkan kita ada a total of 45 items. Okay, ingat dia tak ada bezel, dia tak ada ceiling. So you have to present all of these items in front of your client and then all answer must be answered. Kecuali kalau let's say dia dah macam too fatigue to continue, you may stop the the administration lah and then continue into another day. Boleh tak masalah Okay, recording responses. Okay, so macam tadi ada orang tanya dekat ruangan chat box tu kan. Okay, so the examiner should say or point to the letter A, B, C, D that is correspond to the answer choice. Okay, sebab ada kadang-kadang kanak-kanak yang tak kenal lagi ABC kan. So dia tak boleh nak jawab A ke B ke C. So kita bagi dia point. Right. Number 2, on the record form, circle the letter. Alamak, ya
Plan transfer in 4A lateral G. Plan transfer ini 4A lateral G.
Sorry, ada gangguan sikit. Okay, so you need to circle. Macam tadi contoh-contoh yang kita dah tunjuk tadi, all the response are circled. Okay, dekat record form. Okay, if the person gives no response or says I don't know, okay, you have to try to encourage him or her to respond. Okay, tapi kalau dia refuse juga, kat situ you akan tanda NR. Okay, NR stand for no response. You boleh tanda kat situ. Okay. Number 4, do not indicate whether a response was correct or incorrect by using check marks, plus marks, slash or any other shorthand to record the response. Okay, macam contoh dalam borang borang das lah contohnya kan, kita boleh tik kan dekat kotak tu. Kalau kat sini dia dah memang spesifik dalam manual dia cakap jangan indicate that markings lah, that shorthand marks. Okay, you need to circle. Okay, alright. Sorry, alamak tak nampak. If at any point an answer needs to be rechecked, the meaning of the shorthand may not be apparent. Okay, itulah dia punya explanation dia. Okay, if the examiner must point to the answer choices instead of saying the letters, the examiner should be positioned to clearly see which choice is indicated. Okay, kena make sure lah, kena tanya yang mana satu. Sebab kadang-kadang dia point tu mungkin tak jelas. Nampak macam dia point tu dekat tengah-tengah C dengan D ataupun B dengan C. So you have to make sure sebenarnya yang mana satu jawapan dia. Okay. So sewaktu you record all the responses tu, make sure the record form is out of sight from your client. Okay. Next. Okay, ni contoh dia kan? Contoh apa tu record respon record yang ada dalam record form. Okay. Boleh nampak tak? Sebenarnya kalau you tengok betul-betul dekat record form tu dia ada bolded letters. Itu yang the correct answer sebenarnya. Okay. Contohnya kalau item number 1 tu the bolded letters is A. I'm not sure if you can see it. Boleh nampak tak? Okay, items 2, the bolded letters is C. Item 3, the bolded letters is also C. So, the bolded letters tu maksudnya that is actually the correct response. Okay. Alright, let's go to the next slide. Okay, sorry, dekat clinical history ni you boleh tulis lah. Okay, apa clinical history background client you, and then comments tu biasanya kita akan komen tentang any behavioral factors yang observed before. Okay, next. Okay, scoring. Okay, you need to count all the numbers of correct response. Okay. Kalau ada error, you exclude error tu. Kalau ada NR pun exclude. Okay, only count the numbers of correct response sahaja. Okay. Only the correct answer is indicated in bold to facilitate scoring. Okay, this is the total score. Okay. In MVPT4 ni, there are only 1 over sama macam DTVP2. Okay, dia DTVP2 dia ada subtest kan. Untuk MVPT4 there are no subtest score provided inilah dalam assessment ni. Okay, so kalau tengok kat gambar tu, yang salah tu kenapa yang betul tu kenapa? Ada yang salah, ada yang betul. Kenapa yang belah kiri ni salah? Kenapa yang belah kanan ni betul? Cara nak record response. Yes, okay, mesti bulatkan jawapan. Okay, jangan tanda slash, pangkah ke. Okay, alright. Next. So I think itu saja on my part. Okay. So far ada apa-apa soalan tak regarding administration? Interpretation kita tak masuk lagi. Interpretation nanti Cik Anis Hidayu akan explain to you all lah. Oh sorry, nanti 70%. Okay, what if ada anak-anak ni pointing randomly? What can we do? Okay, you need to ask. Okay, you need to ask which one is actually the correct answer. Okay, kalau let's say dia dah randomly tu, dia dah macam start hyperactive apa semua, and then you rasa macam it's very difficult or too challenging to continue the administration, you may stop the testing. Okay, you may stop the testing and then continue to another day, ataupun ada setengah kanak-kanak tu dia mungkin nak rest kejap je, mungkin 5 minutes, 10 minutes. Biasanya kalau kanak-kanak yang dah besar kan, macam saya buat dekat kanak-kanak disleksia, usually diorang penat, diorang nak rehat sekejap je, 5 minutes. Kita bagi rehat sekejap and then kita sambung balik. Okay. What age group can we use this assessment? Maybe I miss. Okay, age group yang you boleh buat assessment ni is from 4 years old until warga emas, geriatric age, okay, more than 80 years old. So age range tu agak besar. So you can use this assessment almost to all of your clients. Okay, in any age group. Okay, kalau tak ada apa-apa soalan lagi, start 4 years. Okay, terima kasih Encik Amir, tolong jawabkan. Okay, so kalau dah tak ada any question, we may proceed. Now.
Okay, alright. Nozi,
Okay, ada
ada
soalan
soalan
lagi.
lagi.
Okay, what type of visual perception was assessed on each question? Okay, tadi Miss Liliana ada explain. There are 5 types of visual perception tasks or skills being assessed in MVPT4, which is visual closure, visual memory, visual discrimination, figure ground, and visual relationship. Okay, ada 5 tu. Alright. Maksudnya elderly pun boleh ya? Betul, boleh. Even client age more than 80 years old boleh guna MVPT4. Okay. Okay, 1, 2, 3 kalau nak tahu. Example 1, 2, 3 kalau nak tahu. Okay. This is more likely visual relationship. Betul? Example question 1, 2, 3 or items 1, 2, 3 tu dia sebenarnya menggambarkan visual relationship. Okay, orientation of the visual tu dia dah macam flip over apa semua. Okay. Okay. Saya akan emphasize you untuk practice, do a lot of practice with your you kena try buat sendiri dekat diri you and then try buat dekat orang lain juga. Okay, to fully understand MVPT4 ni. Okay. Saya practice with a lot of my friends and my niece, my nephew lah before I started to perform this assessment to my own client. Jika kita nak nilai semula, reassess berapa jarak tempoh yang dicadangkan. Okay. Kalau ikutkan dalam manual, it doesn't say. Okay, ini bagi saya it's really how long duration yang you nak tengok progress kanak-kanak. Dan biasanya kita akan ambil about 6 months kan. Sebenarnya dia tak specifically cakap bila perlu reassess or not. Tapi janganlah sekejap sangat. Janganlah 2 minggu sekali nak assess. Okay. So saya akan I think I will stop my part. Kalau let's say ada soalan apa-apa saya akan jawab dekat chat room. Okay. Can get each type of visual.
Tak apa, Nozi. Sebab kita takut drag masa webinar kita. So apa-apa soalan Cik Nozi boleh jawab dalam chat Zoom boleh?
Okay. Boleh.
Boleh ya?
So thank you everyone.
Okay, alright. So, okay. Thank you Cik Nozi dan thank you juga kepada peserta sebab banyak soalan. Okay. So tanpa buang masa kita jemput next speaker Cik Anis Hidayu untuk ajar macam mana nak interpret data from the MVPT score tadi. Silakan Cik Anis Hidayu.
Okey, Assalamualaikum dan selamat pagi. Terima kasih sebab anda semua berjaya sampai ke part interpretation. Tadi Miss Norzi dia ada cerita pasal administration dengan scoring. So kita dah dapat dia punya scoring, kita nak tengok interpretation. Alright. Okay, kita tengok overview dulu dia punya scoring form. Okay, yang pertama ada record form itu, ada nama. Page kedua ada instruction for test administration, ada interpretation notes dekat bawah sekali. Yang pertama tu, if no answer choices of A or B are given by the examinees, further testing should be conducted to determine the presence of hemisphere visual neglect, which will decrease MVPT4 score since the examinee is not able to attend the left side of the page. Yang ni kita kena ambil tahu jugalah. Okay. The shaded area on the normal curve on the page 1 of the record form mark one standard deviation above and below the age related mean. These graphic cues are intended only to facilitate interpretation. Practitioner should base test interpretation on the guidelines and standard set forth by their profession, agency or score district. Okay, yang ni kita akan tengok dengan manual sekali ya. Kita tengok record form. Pada masa yang sama kita kena refer to the manual. Okay. Page yang ketiga yang ni dia punya scoring area dan page keempat adalah clinical history dan comment space. Okay. First, kita dah buat scoring tadi tu. So kita nak tengok dia punya raw score. Okay, untuk raw score kita kena calculate dia dengan tolak error kanak-kanak yang dia test tadi tu, kita tolak error dia. So kita akan dapat total raw score. Okay, correct answer dalam bold. Do not calculate the example. Okay, yang ni saya cakap dulu. Kita tengok seterusnya ya. Alright. Okay, for example adik Q. Adik Q tadi kita dapat usia dia 5 tahun 7 bulan 8 hari. Okay. Yang sebelah sini ada dia punya circle respond. Okay, kita minta tuan-tuan dan puan-puan tengok yang saya warnakan warna kuning itu. Okay, yang itu adalah correct answer yang diboldkan dalam record form. So, kalau kita ambil gambar memang tak apa nampak, so saya colorkan dia jadi warna kuning. Okay, cuba tuan-tuan dan puan-puan kirakan berapa banyak error dia dan kira raw score adik Q. Kita bagi masa sikit ya. Semua ada ke borang ni record form ni? Dah print dah? Aduh. Ada dengar ke suara saya ke putus-putus?
Dengar.
Dengar. Okey, ada siapa-siapa nak cuba jawab tak? Raw score bagi adik Q. Berapa? Okey. Kita tengok dulu jawapannya. Oops. Okey, ada yang jawab 30. Okey, kita tengok dia punya jawapan dia. Alright. Kat sini, okey, kat situ ada dekat gambar yang saya share ni ada 3 error. Error hijau tu menunjukkan correct response dan yang error merah ni error. Satu lagi di bahagian example. Example jangan kira dia punya respon tu. Alright. Kita tengok. Okay, so kalau kita kira adik Q, dia punya error dia ada 23. So 45 item tolak dengan 23 error. So dapat berapa raw score dia? Kita akan dapat, okay, raw score dia kita akan dapat 22. Bagus, very good. Alright. Okay. Bila kita dah dapat raw score dia, kita kena record raw score di page yang pertama dalam record form. Ni yang saya tunjukkan ni, letak 22. Okay, jangan lupa sebab nanti kita berbalik-balik pula nak tengok waktu nak interpret tu, berbalik-balik kita. Okay, bila dah dapat raw score, kita nak convertkan raw score tu kepada standard score. Okay, bila nak convertkan kepada standard score, kita kena based on age adik Q tadi. So adik Q 5 tahun 7 bulan. So dia kalau ikutkan kolom yang keempat, 5 tahun 7 bulan. Okay, raw score-nya adalah 22. Definitely standard score dia adalah 103. Boleh dapat lagi ke tak? Kita dah lost dah. Ya.
Okay.
Okay, alright. Okay, kita teruskan. Okay, macam biasa bila kita dah dapat dia punya skor, kita kena rekodkan dalam record form di page yang pertama. Ya. Okay, standard score. Apa itu standard score? Tadi dekat page yang kedua saya ada beritahu pasal normal distribution yang ni lah bell shape ni. Okay, kalau kita tengokkan dia, standard score ni dia based on population distribution having a median and mean of 100 and standard deviation of 15. Okay, kat sini ada garisan warna kuning. So dalam menu dia ada mention 99.7% of cases di dalam normal distribution. Okay, dia punya range dia adalah 55 hingga 145. Okay, kita ada yang kat tepi tu represent score below 55 and above 145. Okay, hanya 0.3% saja yang okay tu dalam bulatan tu. Alright, so kalau kita tengok adik Q tadi, dia punya standard score-nya adalah di 103. So dia within sebelah 100 tu ya. Alright, so kita dah dapat. Okay, standard score adik Q 103. Okay, yang ni kita kena convertkan untuk dapatkan dia punya percentile rank. Okay, percentile rank adik Q, kita tengok 103 sebelah dia itu adalah percentile rank dia. Okay, 58. Okay, kita kena ingat ya 58 percentile rank 58 ni bukan bermaksud adik Q ni dia punya performance adalah 58%, bukan bermaksud itu. Okay, percentile rank ni dia indicate adik Q ni perform sama bagus ataupun lebih bagus daripada 54% dalam age yang sama based on normative population dia. Okay. Ada apa-apa soalan tak setakat ni? Okay, kita teruskan lagi ya. Okay, ni percentile dia. So adik Q dia punya percentile rank 58%. Okay, dah dapat tu mesti rekodkan di bahagian yang sama. Kena ingat tak boleh skip sebab nanti kalau kita skip kita dah lost dia punya scoring summary. Okay, untuk age equivalent score. Age equivalent score ni kita selalu tersalah anggap yang mana kita ingat okay, contohnya saya bagi contoh satu assessment iaitu Denver. Okay, Denver kita selalu guna age equivalent kan, umur berapa, performance dia macam ni. Okay, tapi kalau untuk MVPT4 dia tak represent secara tepat performance kanak-kanak tersebut. Okay, sama ada sebab dia range kan. Okay, sama ada dia terlebih overestimate budak tu punya ability ataupun dia underestimate budak tu punya ability. Okay, contoh tadi adik Q umur 5 tahun 7 bulan. Raw score dia adalah 22. Okay, kalau kita tengok dekat table B.3 22, dia punya age equivalent dia adalah 5 tahun 10 bulan. So dia dah over represent ability adik Q ni. Tapi kalau kita based on standard score, adik Q dia 103, betul? So 103 dia well within normal limit. Maksudnya dia tak adalah advanced ke apa ke, dia within normal limit. So So age equivalent score ni dia tak betul-betul represent kanak-kanak tu punya ability lah. Cumanya age equivalent score ni dia membantu dalam documentation progress. Tapi kita tak boleh guna semasa nak diagnostik ataupun nak determine level of impairment seseorang kanak-kanak tersebut. Okay. Right. Kita pergi seterusnya. Okay. Kita dah dapat, kita isikan di ruangan age equivalent. So adik Q tadi dapat 5 tahun 10 bulan. Okay, kita tulis saja dalam. Alright, standard score confident interval. Okay, tadi kita dah cerita raw score, standard score, percentile range, age equivalent. So kita sekarang nak tahu standard score confident interval. Kita nak tahu dia punya range kanak-kanak punya performance. Okay, dia punya key point untuk confident interval ni adalah client true abilities. Kita nak tengok dia fall di range yang mana. Okay. Macam kita sedia maklum, tak ada benda dalam dunia ni 100%. So dia mesti ada kita macam nak cakap some error. Okay, some error. So dalam confident interval ni dia ada dua option lah, iaitu 90% ataupun 95%. Okay, dalam manual dia tak mention you mesti pilih 90% ataupun 95%. You boleh pilih either sama ada 90 ataupun 95, tapi dia ada mention the smaller confident interval, the more accurate of the score that reflect kanak-kanak tu punya ability. Contohnya macam katakanlah kita pilih 90%. So error dia punya error scoring tu adalah 10%. Kalau kita pilih 95%, hanya 5% saja yang dia error. So yang mana lagi bagus, saya punya pendapat, selalunya kita akan pilih 95% lah. Okay, tapi kita kena ingat result yang kita dapat ni, apa-apa test pun dia bukannya menunjukkan betul-betul ability kanak-kanak tersebut. Kadang-kadang kanak-kanak ni dia mungkin perform lebih baik. Kadang-kadang perform tak berapa nak mencapai dia punya ability lah. Okay, ada beberapa faktor yang effect dia punya performance. Contohnya macam attentiveness, penat ke. So bila dah jadi macam tu dia akan low performance. Okay. So ni dia just capture kanak-kanak tu punya abilities within range dia. Okay. Kita tengok apa itu aku cakap, kena tengok juga cara nak kira dia. Alright, so ni confident interval dia ada calculation dia lah. Kalau kita tengok di record form di page yang terakhir, page 4, di bawah ruangan komen ada satu table lah. Okay, table ni. Alright, so formula dia untuk dapatkan lower level. Okay, kita kena cari standard score kanak-kanak dan kita tolak yang kita pilih percentage untuk confident interval. Kita dapat lower level lah, lower level confident interval. Bila kita nak cari yang maximum punya, kita just tambah saja yang 90 ataupun 95% confident interval. Okay, contoh, saya bagi contoh dulu. Okay, contohnya umur kanak-kanak tersebut 9 tahun. So saya pilih 95% confident interval. So dia punya standard score dia adalah 96. Okay, kalau kita tengok dekat table di sebelah kiri, okay, kita tengok age, kolom yang paling kiri sekali, age dia umur 9 tahun. So kita tengok kolom yang ketiga, 95% confident interval. Sudah ada bagi figure kat situ, 15.47. Okay, so standard score 96 tolak 15.47. Kita dapat 80.53. Okay, ni ada lower level ability budak tu. So kita nak tahu maksimum pula. Maksimum standard score 96 tambah dengan 15.47, so kita dapat 111.47. Okey, cara nak tulis dia, kita akan letak lower level dulu iaitu 80.53 to 111.47. Okey, so kita akan tahulah 95% probability that kanak-kanak punya true score ataupun true ability dia on MVPT4 ni between 80.53 to 111.47. Within. Ya. Alright. Okay, dah dapat ni mesti kita cuba pula. Nak tahu tuan-tuan dan puan-puan faham ke tidak ni, sebab ini dia ada tulis dalam manual tapi kita kena further kena try barulah kita faham. Kalau kita baca tak try pun susah juga. Dia susah nak faham sikit. Okey. Sekarang kita tengok kita based on adik Q. Alright, kat sini saya tulis adik Q, kita pilihkan 95% confident interval. So saya nak tanya kat sini, ada tak yang boleh beritahu saya lower level bagi adik Q ni? Boleh tolong kirakan ke 103 tolak dengan 14.40. Dapat berapa? Yes, ada siapa-siapa nak jawab tak? Tak cuba tak tahu. Very good. Okay, ada few jawab yes. Okay, ni just apa yang tuan-tuan dan puan-puan perlukan, kalkulator je. Ui, ada lagi power. Okay, Puan Zaliza, dia dah terus siap-siap kira lower dan upper level sekali. Oh, bagus. Okay, jom kita tengok jawapan siapa yang kena. Alright, so betul lah yang tuan-tuan dan puan-puan kirakan tu. Okay, bila kita dah dapat ni, so kita tahu adik Q ni dia punya true ability dia untuk MVPT4 ni between 88.6 to 117.4 within dia. So ni normal lah ni. Alright, dah dapat tu kita kena recordkan di record form. Jangan lupa ni, kena kirakan. Okay, kat sini standard score confident interval kita kena circle lah yang mana satu kita guna supaya next bila kita nak reassess kita tak adalah pilih yang lebih tinggi confident interval ke ataupun lebih rendah confident interval. Kita nak dia sama supaya dia valid lah. Okay. Alright. So kita ada practical session. Okay, apa yang tuan-tuan dan puan-puan perlu lakukan, sila pastikan anda mempunyai record form yang kosong untuk saya untuk kita isikan bersama. Okay, saya akan beri dia punya case dia. Saya akan beritahu date of test dan dia punya date of birth dia. Alright, setakat ni ada apa-apa nak tanya tak sebelum kita further to practical session?
Maybe peserta kena sediakan juga manual, so boleh dalam practical session ni nanti akan ada borang record form yang dah ada score. So nanti peserta akan diminta untuk interpret data tu lah. So kena tengok manual juga. Okay, alright. Okay, Anis, teruskan.
Okay, kita teruskan dengan practical session ya. Tuan-tuan perempuan mesti ada record form, ada pensel ataupun pen dan juga manual. Manual penting ya, kalau tak ada manual tak susah nak interpret. Alright, so kita go to the next slide. Okay, so ini adalah case yang kita berikan. adik Z, date of test dia adalah hari ini 1/7/2021. And date of birth dia adalah 26 hari bulan 4 tahun 2013. Okey, cuba tuan-tuan dan puan-puan kirakan chronological age untuk adik Z. Tadi Cik Nozi dah ajar, dah bagi sampel dah. Sekarang kita nak perform pula. Okey. Jom kita buat sama-sama. Okey, saya beri masa sikit lah. Sebab dia nak kena pinjam lah. Nak kena tambah lah. Nak kena tolak lah. Okey. Ada dah yang jawab. Semangat ni. Wah. Semangat. Bagus. Ya, betul. Betul lah, adik Z ni dia punya chronological age adalah 8 tahun, 2 bulan, 5 hari. Okay, so kita tengok pula di Allah. Kita tengok pula di circle respon dia. Okay, ada example 1, 2, 3, example lepas tu 4, 5, 6. Okay, kita dah tengok. Saya dah bulatkan juga dia punya respon kanak-kanak ni. Okay, based on tuan-tuan dan puan-puan punya record form, mesti ingat jawapan yang betul adalah di dalam bold. Okay, make sure kira betul-betul sebab ni memang banyak. Dan juga kena ingat ya, example jangan kira. Kita skip kat example tu. Walaupun betul ke salah ke, biarkan je. Tak perlu kira. Okey, dah ada ke yang berjaya menyiapkan dengan keadaan yang segera? Juling mata nak tengok. Tapi kalau tuan-tuan dan puan-puan ada dia punya record form yang jelas, dia punya printed tu memang nampak lah dia punya bold tu. So, dia akan lebih membantu lah. Alright, ada ke yang boleh jawab total error dia dan raw score? Ya, error dan raw score. Boleh ke tu? Anyone from the floor ke? 23. Okey, Encik Chong, Encik Chong Kong Wai. Alright, Encik Chong jawab 23 error. Betul ke? Betul ke tu? Okay, kita tengok jawapannya. Ada lagi chat? Ada yang berbeza markah ke? 23. Wait. Oh, okay. Ada yang cakap 23 error, ada yang cakap 23 raw. Alright. Okay, jom kita tengok apa jawapan dia. Alright, so error dia ada 22 sahaja. So untuk dapatkan raw score kita mesti guna total item 45 tu tolak dengan error. So dapat berapa raw score dia? Alright. Very good. Ya, kita memang selalu akan terbalik sebab kita selalu akan kira yang betul kan. Tapi kita nak mengingatkan macam tu, kita kena kira yang error dulu barulah kita kira yang betul. So jawapannya error 22, raw score-nya adalah 23. Okey, bagus. Mana-mana benda pun mesti kali pertama ada kesalahannya. Yang itulah yang membuat kita belajar, betul tak? Biasalah. Okey, dah dapat ni. Okey, macam saya cakap sebelum ni, dah dapat dia punya skor, mesti tulis dalam dia punya record form di page yang pertama. Alright. Okay, yang seterusnya kita dah dapat row score. So sekarang kita nak tahu standard score untuk adik Z. Row score dia tadi adalah 20, berapa tadi? 20. 23. So row score-nya adalah 23. So dia punya standard form. Alright, very good. Okay, betul. Yes. Okay, kita tuan-tuan dan puan-puan jangan lupa untuk recordkan di dalam record form. Nanti kita akan tengok sama-sama mana tuan-tuan dan puan-puan recordkan. Very good. Okay, dah dapat standard score. Sekarang kita nak check pula dia punya percentile rank. Ini lagi juling mata nak tengok. Okay, standard score yang tadi dapat tu nak convertkan kepada percentile rank, kita mesti based on table B.2. Okay. Kat sebelah kiri sekali tu ada dia punya standard score. Dia bersebelahan dia. Dah dapat dah dia punya jawapan. Alright, jangan lupa tanda recordkan di dalam record form. Very good. Alright, so okay, untuk dapatkan age equivalent dia kita guna table B.3. Jadi kita kena patah balik. Tengok row score adik Z tadi tu dan kita tengokkan, kita matchkan di age equivalent. Boleh? Boleh, saya takkan bagi tahu jawapan dia nanti. Lepas-lepas ni baru saya bagi tahu jawapan. Oh, semangat. Alright. Good. Okay, dah dapat age equivalent, recordkan di record form. Okay, jangan lupa check confidence interval dia. Okay, kat sini tuan-tuan dan puan-puan boleh pilih nak guna 90% ke nak guna 95%. Tapi dalam few studies dia kata lebih kecil dia punya error tu lagi bagus lah. Maksudnya lagi confident kita dengan budak tu punya performance. Alright. Mesti direcordkan di record form. Suka saya ulang-ulang sebab memang kita selalu missing ni. Alright. Okay, ni dia punya record form adik Z. Kita dah tahu dia punya chronological age. Okay, sekarang kita dah tahu row score dia. Okay, row score dia berapa? Tadi tu. Tanya lagi saya. Mana tahu? Very good. Yes. Okay, row score dia adalah 23. Betul. Okay, bila dah di-convertkan untuk dapatkan standard score dapat berapa? 90. Very good. Then, okay. Lepas tu dia punya percentile rank. Semangat. Very good. Okay. Dapat 25%. Alright, age equivalent. Tadi dah ada dah yang jawab. Kita just letakkan di dalam ni je. Score summary. Betul. 6 tahun 4 bulan. Okay, standard score confidence interval. Alright, kalau kita pilih okay, kalau kita pilih 90%, adakah yang kat sini pilih 90% untuk confidence interval? Saya just nak tahu je. Ke semua dah memang confident nak pilih 95%? Alright, very good. Ni disarankan lah tapi bukan absolute. Boleh pilih. Ikut mana yang suka lah. Alright, kalau kita pilih 95%, bagus. So kita akan dapat berapa dia punya confidence interval dia. Lower level hingga ke upper level. dapat 2. Okey. Alright. Oh, ada yang jawapan berbeza. Okay, let's see ya. Let's see. Alright. Oh, ada lagi jawapan lain. Okey, kita cuba tengok jawapan dia ya. Ada ke yang jawapan betul? Dia kan standard score dia. Standard score dia 90. 90. Ya. 90 tu kena tolak dengan 13.31 lah kalau nak tengok yang ni yang 90%. Kalau 95% dia memang berbeza lah. Tapi mesti kena ingat kita kena circlekan yang mana satu. Kita pakai 90% ke ataupun 95% untuk pastikan kesinambungan dia. Alright. Dah dapat dah. Okay. Ada lagi. Okay. So yang ni yang tadi tu dah siap lah. So sini quotient bagi score interpretation. Okay, sebab dia ada banyak skor, banyak cara untuk interpret. Tapi kita kena ingat apa-apa test dalam dunia ni, dalam dunia bukan setakat dunia OT saja, apa-apa test di dalam dunia ni dia hanyalah snapshot kepada seseorang performance di particular point in time, typo, particular point in time on particular set of tasks. Saya tak pernah jumpa satu assessment yang dia test semua sekali. Dia mesti pilih satu. Contohnya macam MBPT4 dia memang pilih satu je. So set of task dia adalah visual perception. Itu. Alright. So dia punya scoring interpretation ni dia bukan cerita a whole story. Kenapa seseorang tu bertindak ataupun performance dia dengan cara yang dia buat tu. Tak ada, dia takkan cerita semualah. Disebabkan itulah kita memerlukan ada information yang daripada penggunaan serial of assessment, beberapa assessment untuk kita ambil ada information yang kita gabungkan untuk kita jadikan satu multi dimensional profile. Nak tahu dia ni abilitiesnya di mana, weaknessnya di mana. Okay, kita kena guna few test lah untuk dapatkan the whole, hopefully the whole interpretation berkenaan kanak-kanak tersebut. Okay, satu test hanya boleh provide one piece of puzzle at one point in time. Macam saya cakap tadi, satu test yang kita gunakan hanya satu saja yang dia bagi evaluation. Contohnya MBPT4 dia assess visual perception. Dia tak assess benda lain. Dia cuma cakap visual perception. Alright. So sebab itulah dia satu testnya hanya boleh provide one evaluation ataupun one interpretation berkenaan sesetengah satu task yang kita test lah. Alright, test yang kita buat ni dia memang kita buat beberapa test ni tujuannya adalah untuk membantu profesional, help profesional ke macam kita ni healthcare practitioner untuk evaluate seseorang punya ability tu dan kita basekan dia punya evaluation tu, kita plan, kita develop planning and then kita intervene je based on planning yang kita dah buat lah. Okay, kita mesti sebagai examiner, kita mestilah sensitif terhadap beberapa factors yang di sekeliling kita lah. Okay, untuk scope MBPT4 ni, kita kena tengok kanak-kanak yang kita buat test ni, adakah dia punya factors ni, factors yang mengganggu dia punya performance tu, adakah fatigue ke, inactiveness ke, incooperativeness ke. So kita kena tengok. Kalau kata ada faktor-faktor yang mengganggu dia punya performance semasa testing session, so ada maybe ada masalah sikit lah. Kalau ada dia punya behavior macam ni, so dia punya score kalau kita completekan juga mungkin dia tak menunjukkan true ability kepada kanak-kanak tersebut. Okay. Punya banyak bercerita daripada pagi sampai ke petang. So hopefully semua participant berjaya memahami dan hopefully menggunakan MVP-T4 ni di clinical setting masing-masing. Alright, sebelum kita dah di penghujung webinar dah ni. So ada apa-apa persoalan ke ataupun persoalan yang belum dijawab ke, takut kita terlepas pandang, mungkin boleh dropkan question tu di chat box. Okay, dan juga Encik Anam ada letakkan feedback form. Kita sertakan link di chat box. So minta tuan-tuan dan puan-puan mengisi feedback form tu sebagai proof of attendance dan kita akan releasekan e-certificate. Alright. So ini adalah references yang kita dah guna sepanjang kita punya webinar ini. And thank you. Thank you, saya dah settle dah. So kita berbalik pada Encik Anam.
Okey, terima kasih kepada Cik Anis Hidayu untuk interpretation data. Harap semua peserta dapat conduct assessment ni dari awal hingga akhir and then berjaya interpret data sebagaimana yang telah diajar lah. Okay, alright. Sebelum itu ada feedback form link dalam chat. Semua peserta dikehendaki untuk isi feedback form tersebutlah untuk dapatkan sijil. Kemudian ada soalan lagi yang untuk webinar ini, so kita boleh jawab. Ataupun ada speaker yang lain mau jawab soalan yang tadi mungkin tak sempat jawab dalam chat. Kita mulakan dengan speaker Cik Liliana. Ada soalan ataupun soalan yang termiss tadi yang Cik Liliana boleh jawab?
Okay, just early on just now, Mr. Kanan asked me like, hi Liliana, what is the credibility of the instrument developers? How they came up with this motor reduced component and why did they separate the motor enhanced visual perceptual skills? Okay, credibility of the instrument developers. Okay, the author of MVP-T4 is Colarusso and also Hamili. So both of Colarusso is a special education teacher, meanwhile Hamili is educational psychologist in special education as well. Okay, for them to publish this assessment, they collaborate with some other OT and also school psychologists lah. Okay, and then how they came up with this motor reduced component. Okay, why they came up? Because they want to separate the motor enhanced visual perceptual skill. Because this assessment is motor free assessment. So that's why they came up with this assessment MVP-T4. Okay, because to separate the motor enhanced visual perceptual skill. I hope I answered that question lah. Okay. And then another question is, are there evidence of visual motor reduced development trajectory? Which of these components developed first? Are there any evidence? Okay, there are evidence that visual motor delay will also reduce developmental delay. Okay, I found some studies already, like 8 or 11 just now. Okay, many studies found that the visual motor has positive influence on fine motor development, self-regulation, handwriting performance, and also academic achievement. And then many researchers reported that visual motor skills of children develop quickly in the early childhood, and the trajectory of visual motor development among children was consistent before 3 years, but inconsistent from 3 to 7 years lah. Okay, and other question is, which of these component develop first? Okay, actually, motor component and visual component, they develop concurrently lah. So if one of the development is delayed, so the children will have the whole developmental delay. Okay. I think that's all I can answer. I'm not sure if my answer is like answering the question.
Thank you, Liana. Can you hear me, Liana?
Yeah, I can hear you.
Yeah, very good. Thank you for all the thing. Is that just like to what I understand is that it's very difficult to distinguish visual motor reduce and visual motor integration. Developers were trying to separate these two domains, but there are interrelators between them, right? So there was a lot of confusion on that. And theory-wise, they were trying to argue on the two as a separate identity functioning among each other. That's when there was a difficulty. So they believe, this developer believe, that they can measure visual motor free is much better, because there is no what we call effects, sound effects from the visual motor integration component. So that's the reason they developed motor visual perception, like TVPS and all that. It's said. The other part that DTVP you could see is that they have both motor reduce and motor integration inside it, but yet they can separate it as three components actually. One is motor free, one is motor reduce, another one is general visual motor component, where both are added together. So this is what the argument is about. Still there is no conclusive evidence that either one is influencing another one. So this is the argument still going on, right? That is what I can talk to you about those aspects. On term of yeah, that's what I say. So Liana, you have explained for your effort and the team. Thank you very much. I understood better now. Thank you for your support. Bye.
Hi.
Thank you,
If
Mr. Kanan, sebab ya, Puan Nur Hidayah. Okay.
Hi, Mr. Kanan. Yeah, I think I would like to say a few things. I'm really not quite familiar with the MVPT because I used to practice DTVP, and that's what the things that I'm about to ask. But Mr. Kanan already explained it to me about the distinction between the because MVPT is not be able to represent the whole interpretations of the general visual perception compared to DTVP when there is separate subtests to test the visual motor integration components. But having said that, it's quite practical, I guess. So maybe that's a little bit my concerns, because this is like motor free, motor reduced subtest, and there is no component of VMI being assessed. But yeah, I think that's the things lah. Okay, thank you. I think Mr. Khan already explained it well. All right. Okay, guys. Thank you.
Okay, I just like this is very interesting. Okay, I like just mention also MVPT, the theory behind it. Yeah, I always like to say that please read the theory. The theory behind motor free visual perception is that motor free visual perception is what do I say? Closely associated with increase of age, right? Up to certain age, and then also visual perception, motor free visual perception will reduce if the age gets higher. That's the reason this assessment was formed, because it can cater from children as young and as old as adult as old as 80. So the theory is those who are 80, 60, or sorry, 70 and above, they will perform very badly in motor free visual perception. And also those children who are growing up 4 to maybe 5, so they will you will find the 4 years is doing less, performing less compared to the 10 years old. So this is a theory behind motor free visual perception, which says that the younger age, it escalates until to come to an optimum level, then it reduces towards the end. So it's very interesting to see that in our population, we have to look at that. So that's one of the theory behind this motor free visual perception. The other thing is I would like to mention also is that I don't know, Liana or Nozi mentioned that there is a good discriminating validity of motor free visual perception test on children with learning disability. That's a very interesting study. I think you should go in. If you all can pass it to me, I like to read about it because I want to know what are the components which is really, really discriminating their learning disability using these visual perceptions. So I might be even come up with some, this study would indicate that probably the learning disability have most problem with visual closure, right? Or spatial relationship. So that's very interesting study. So I think it's good for us to go in deeper and find out all this. So if you can discriminate it, right? So that's the thing. All right. Sorry for taking your time. I'm sorry, Anam, I never asked permission for this. Thank you very much.
Tak apa, Mr. Kanan, thank you juga. Tapi nanti kami akan share study MVPT dengan berkaitan MVPT dengan learning disabilities. Actually studies tu baru juga, dia test for sensitivity and specificity untuk MVPT ni dengan learning disabilities lah. Tapi nanti kami akan share dengan Mr. Kanan lah paper tu. Okey. Untuk speaker yang lain mungkin ada jawapan untuk soalan yang termis, Cik Nozi.
Okay, untuk saya ada respon dalam chat room. Okay, boleh go through chat room tu lah. Ada satu soalan yang saya tak jawab, which is dia nak tahu what are the visual perception scale in from item 1 to item 45 kan. Okay, kalau ikut betul-betul it does not mention specific lah what are the function and all. But based on my readings, my own understanding, I have written dekat dalam chat box tu. You can go through. Okay, those are the names. But ada some items they combined visual perception skill tu. Dia tak semestinya satu saja. But the most important thing is masa you interpret the scoring, you have to interpret the general visual perception skills. Okay, it does not go by subtest. Macam kalau let's say you guna developmental test of visual perception 2 di TVP 2, yes, dia memang dah spesifik, dah asingkan each of they are subtest kan of visual skill. Dia ada figure ground, dia ada visual closure. But for MVPT, you tak boleh buat macam tu lah. Okay, and that's all from me.
Okay, thank you Nozi. Speaker Anis Hidayu, ada soalan yang jawapan untuk soalan yang termis?
Okey, untuk bahagian saya macam saya dah jawab semua dah. Waktu kita buat practical session tadi lah. So kalau ada apa-apa soalan lagi yang ada kemusykilan, boleh drop your question in the chat box. Okay, dia kalau tuan-tuan dan perempuan ada dia punya kids dia, memang senang lah untuk interpret the score.
Alright. So harap-harap semua peserta selepas webinar ini dapat conduct assessment ini dengan betul dan berjaya, dan harap-harapnya assessment ini boleh diaplikasikan dalam clinical practice masing-masing. Okey, buat dekat department kah, dekat PDK ataupun dekat sekolah. Semoga ianya berguna. Sebelum kita mengakhiri sesi webinar kita pada hari ini, boleh on video kan? Kita nak screenshot semua peserta yang ada pada hari ini. Boleh? Kita semua ada berapa peserta semua sekarang? Speakers, kita ada berapa peserta? Dalam 90 lebih kan? Termasuk dekat YouTube kan? Okay, alright. Kita tunggu yang lain buka video. Okay, okay. Senyum, kita screenshot. 1, 2, 3. Alright, freestyle. Okay, 1, 2, 3. Lagi ada? 1, 2, 3. Okay. Okay, thank you kepada semua peserta. Terima kasih banyak-banyak sebab join our webinar. So ada next webinar lagi pada esok rasanya kalau tak silap. So kepada peserta yang sudah register tu so boleh take part lah untuk esok punya webinar. So okay, terima kasih. Bye bye. Assalamualaikum. Selamat tengah hari. Terima kasih.